Okay, welcome everybody. Today is the Board of County Commissioners of Pickens County meeting on Tuesday, February 25th, 2020. And this is a work session. First up, we have I will call a special meeting of the Board of Social Services. And this is our quarterly meeting. So I'm not sure, Nan, are you? I have to vote on going in.
We need a motion to convene.
Motion to go into.
So moved.
No, second.
All in favor?
Aye.
Aye. Okay, we are in session as Board of Social Services.
Great, thank you so much. I'm Nan Sundin, I'm the Human Services Director, here with the Human Services team that are around the room. I'll let the people at the table introduce themselves right now.
Lindsay Maish, Deputy Director, Human Services.
Sam Lander-Casper, I manage the Economic Assistance Department.
Kelly Pazar, Finance for Human Services.
And we have some other members in the back. We have a very full agenda for the Board of Social Services today. So we're just going to get through what we can. You have packet material. Just a reminder that the Board of County Commissioners serves as the Board of Social Services. It's a statutory obligation to ensure two things in particular. One is that we are spending the money. You need to approve the expenditures of our division, and then you need to approve the payrolls, which is the direct benefits, client benefits for the welfare programs. Other than that, we use this time to update you all on other things. This year in particular, this is our fourth quarter meeting. We meet quarterly. And so staff has taken the opportunity to present some year-end data so you can see the trends, some of the trends in terms of caseload. What we're going to do today, well, just let me back up. Just a reminder, Human Services is child protection services, all eligibility services for federal and state welfare programs, senior services, veteran services, and the Healthy Community Fund. So that's sort of all of what gets encompassed. What you all review are specifically the expenditures of the Child Welfare Program, Adult Protection, and Economic Assistance, and those are the mandated services. We're going to use this time to present other things to you today. In particular, you asked for a presentation from Ross Brooks. He'll be coming at 1:30. But we're going to start with Kelly talking about the expenditures, and then we're going to have a brief presentation from Sam about some of our trends around SNAP and Medicaid caseload, which really will help start to inform Ross's presentation on what's going on with Mountain Family Health. So,
Thank you, Nan. Good afternoon, everyone. Today, we've asked you to review the fourth quarter, October through December expenditure reports, and a reminder of what's been going on for the last couple of quarters as well. Due to the county's new enterprise resource planning software and the chart of accounts conversion, we're not able to report budget versus actuals broken out by program now, but we'll resume showing that with the first quarter of 2020. But that said, I do have totals on those amounts for you. Total revenues and expenditures compared to budget. The program revenues for the year end 2019 ended at 99%, and the program expenditures ended at 88% through December. Let's see. At the time that staff pulled those numbers, though, there might have been a few expenditures that weren't booked yet, just due to timing. And a note that expenditures are less than budgeted at 88% because we budget a maximum of what we think we might spend, especially for things like child care and SNAP. But we didn't use both of those up to the level budgeted, especially child care, so we ended the year at 88%.
the reason why we don't use all of the CCAP expenditures is because we bought dollars from some of our neighbors. And so you all remember that we have the ability to buy parts of other counties' allocations for about 11 cents on the dollar. So It's a really inexpensive way for us to overspend, serve all the families we can serve, and still get reimbursed. But we have to budget to that over expenditure. So that's why it looks a little cuckoo.
Yes, thank you, Nan. Any questions so far?
Kelly?
Yeah.
Is it possible to do anything to get closer to the utilization in the CCAP dollars with the budgeted amount? Like,
So
are there
we,
program or policy recommendations to get close the gap?
So let me see if I can clarify. There isn't a gap. We're serving 100% of the people who come through who are eligible, which is really not happening anywhere else in the state. The gap was that we budgeted higher in case we didn't get reimbursed or we couldn't buy the dollars. Does that help you? So there isn't a gap in who we're serving at this point, which is really great news for us.
Yeah.
Statewide, the state on an average is serving 13% of those who are eligible.
13?
13, 1-3. We're serving 100% of the people who come in who are eligible. That's not 100% of who's eligible, but it is, we are really fortunate that you all have a liberal policy to allow us to overspend and to try to buy the allocation from counties that are underspending.
Okay, thank you.
Does that help?
Yeah.
It's the question about just, it's possible that some 2019 expenditures haven't come in yet. What percentage bump will that change to your?
It would be very small, and they would
So
have been
nothing
booked by
significant.
now. We had finance had a date of February 7th, but we pulled these numbers before February 7th.
Okay, so we're
Yeah,
still in,
it could all be in here, but
okay.
nothing big. And then we're going to ask you to make a motion to approve the expenditures, but on this chart, total expenditures by quarter, I do have a couple notes. Again, due to the new chart of accounts, the expenditures that you see in quarter 4 might not be spread out between the 6 programs exactly how it's been reported in the older system, but again, beginning with 2020, it will look straightforward again. And then you'll see a child welfare jump in expenditures in quarter 4 from the other quarters. And this was mostly due to court-ordered out-of-home child placements. But for the whole year, child welfare expenditures, the total was just under budget at 98%. So even though there was a large jump, we did have that all budgeted for the year. And any questions on the fourth quarter expenditures?
I'll make a motion to approve.
Second.
Okay, it's been moved and seconded to approve the fourth quarter expenditures. Any further discussion? All in favor, say aye.
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 Okay, thank you.
Thank you. So then we have the payrolls. And Sam, do you want to go over this?
Yep. So like Nan mentioned, we're going to talk a little bit about some trends in Medicaid and SNAP caseloads in the next slide. So I thought in this one I would mostly go over if we see any trends in the other programs. One thing that we did want to call out is that, as you all know, over the last year or so, the Child Care Assistance Program has seen some policy changes that we've done here at the local level, as well as some state changes that had some significant fluctuations in the payrolls, but we're hoping that this over the last 2 quarters has started to even out a little bit at around 60,000, if you average it 62,000 per quarter in direct expenditures. So that's funds that are being paid out directly to child care providers in exchange for care. All of these payrolls here are the direct expenditures to the customers or to the vendors that are providing the services. The other program we wanted to talk a little bit about on this slide is the Colorado Works program. We've seen an uptick in expenditures there, and I know I've mentioned this a few times. We had seen decreasing participation in this program because of the very low income threshold for the basic cash assistance program, which is a program that provides eligible members a monthly cash benefit. And we've started utilizing the other side of the Colorado Works program, which is the Diversion Program, which is for households with children experiencing some sort of financial emergency. And in those instances, we're able to issue a higher benefit amount in a lump sum to help avoid, typically it's some issue with a with rent or, loss of a job or a car issue for getting to work. And that intervention hopefully will manage to keep them on their self-sufficient the way they've been in the past. So we did find some success in utilizing those diversions more over the last few quarters versus attempting to rely on the basic cash assistance program. Other than that, we did see an uptick this quarter in LEAP payments. That's because LEAP begins in November. That's the Low Income Energy Assistance Program. We're happy to see people getting on that. We typically see our highest payouts in May and June, but November and December are also heavier months for that right after the program opens up. So it's good to see those dollars coming into the community to help people keep their utilities on. And here, like I said, we'll talk more about Medicaid and food assistance in the next slide. So here we'd like to ask for a motion to approve the 2019 fourth quarter payrolls.
Kelly?
Can I just ask a question first? Do you know how many individuals are being served from all of these economic assistance programs?
I could pull that information. Yes,
Okay.
we do keep track of the individual caseloads. And I can say anecdotally, just because I was working in this today, every year we help around 80 different folks with LEAP. And for food assistance, the numbers have been going down substantially. I believe right now we're around 160 cases and 230 individuals. And for Medicaid, we're hovering right around 1,400. That's including CHP plus. That's individuals, so 1,450 people. The old age pension program is typically combined less than 15 individuals. I think right now there's two parts to old age pension, which is A and B. I think right now we have about 5 for the A and about 7 for the B. Child care assistance, we fluctuate typically around 20 to 25 cases, and generally it's 1 child per case, but we do have a couple with 2 children. So anywhere between 20 to 25 up to 30 to 35 is kind of our range that we're working with there.
Great, thank you. That really gives me a universe of just the volume of traffic that you're seeing on an annual basis. So thanks.
Just following up on that, I'd be curious how many of those are duplicates, like somebody getting all these different, one individual getting a lot of them. People are just getting 1 or 2 services, and that would be interesting to have that figure also.
I don't know if our system would allow us to pull that. I mean, there would probably be a way to take all of the reports and run them against each other, although I can say just because we work, we work pretty closely with these folks. We get to know people. There is probably a 10% to 15%, I would estimate, caseload where these folks are getting Medicaid, food assistance, child care assistance, maybe some LEAP is common to throw in there as well. Those are kind of when we see the folks who need the most assistance, those are kind of those 4 programs that really help bundle to get them, to a point where they're maintaining their quality of life here in Pickens County.
Okay.
Thank you.
Oh, great.
I was just looking at the low income energy assistance program, and I understand it's probably for people who are having trouble making utilities in their rental unit, or I'm just wondering, are there opportunities there if you're looking at something in a situation where there may be a way to help them with energy conservation? I don't know if the Corps has ever dealt with that. Yeah. Just wondering if there's opportunities for synergy there that haven't been tapped regarding, if somebody's coming back perpetually because they're not making the utility payments, is there something else we can do to help?
There's the Northwest Cog Weatherization Program that Carl participates
Yeah,
in.
so, and we're
But
connected with that?
Yeah.
Yes. So we do, so for homeowners, not so much for renters, we do mention if someone says, well, I'm renting this house and the doors don't close and all the heat's blowing out and my bills we'll mention you should let your landlord know about CORE. But when we have folks who are homeowners, we definitely mention CORE. There is some funding through the Alpine Area Agency on Aging for certain customers. LEAP itself can help with furnace replacements as well. So there are some options, obviously not as much as we'd like, but there are ways for folks to help get there. Not so much around efficiency. I know CORE does that, but At least if a furnace goes out or something like that, there's
Placement,
some,
right.
exactly, some additional resources there.
And I will just note, CC4CA is supporting a bill for energy efficiency assistance that's structured similar to
Great.
low-income.
Just if we're
Low
gonna help them
energy
buy a new furnace, let's make sure it's an efficient one.
Good one.
Good furnace, yeah.
Yeah. Yeah.
Great, thank you.
Absolutely.
And so we're just looking for a motion.
I'll
to
make a
approve.
motion to approve the 2019 fourth quarter payrolls.
Is there a second?
I'll second.
It's moved in second and to approve the fourth quarter payrolls. All in favor, say aye.
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 Great.
Thank you.
Thank you.
Thank you.
All right, so here we are looking at both SNAP and Medicaid and really looking at the caseloads over time, over the last 3 years. I hope everybody can read that. What we really see here is we peaked around the end of 2017 and early 18 for both programs as far as caseloads go. Enrollment, if you look at the trend lines for enrollment, or the charts for enrollment, they're fairly similar to these, so I didn't want to include both. I thought caseload was a pretty good description of how this works. But as you can see, over the last, since about January of 2018, we've seen a pretty steady decline in enrollment in both programs. There is a spike in the SNAP there around November through January. Don't really know what happened in there, but it's concerning that we're seeing this drop. And there's a lot of things that could possibly feed into it. In the more recent months, especially with SNAP, we've heard more about public charge. And I passed out some information that we received from the governor's office, and that information's helpful for people as far as speaking points. And then also there's a second attachment there for how it concerns folks who might be worried if it applies to them. So we noticed when there were first, in our department, we had a number of calls when public charge was first announced prior to it going to the Supreme Court and having an injunction, where people were calling and saying, I want my case closed for myself, for my kids, I can't risk this. I guess I should give a little background on public charge. I'm going ahead of myself. Public charge is it's being able to be considered during immigration hearings. It means that a person who utilizes public benefits like Medicaid, food assistance, some HUD housing, it can be considered when they're going in front of the immigration judges to get their citizenship. Public charge is essentially phrasing for meaning you are a charge to the public coffers. And the way they've explained it to us is it's looked disfavorably upon in these immigration proceedings. So when this first rolled out, we had a number of families calling, and these families ran the gamut from, there's this stereotypical idea of what a migrant family might look like, but it wasn't limited to that. Almost anybody involving themselves in the immigration system was calling and saying, how does this affect us? Others were saying, you know what, we're just not going to chance it. We'll figure out how to get insurance. We'll do without. SNAP, the food assistance, was dropped more quickly even than the medical, because I think people see food as something that's less necessary, even though we know it's not. But it's easier to let that go with the high cost of insurance here. So we really want to get the word out about public charge, and that if your children are citizens, they're still eligible for medical assistance, for food assistance. It's really based on the individual. So that's the important information we wanted to get out there. And I think when Ross Brooks is here from Mountain Family Health and they're talking about the level of uninsured they're seeing, we can see a pretty direct correlation, because there's less people on Medicaid, and there's obviously a portion of those folks who are no longer on insurance. I'm sure there's some who are maybe able to go out and purchase insurance, or the problem is if you let go of Medicaid voluntarily without going over income, you're not able to purchase a plan through the marketplace. You have to transition off of Medicaid due to going over income in order to be eligible. So if you voluntarily say, I no longer want Medicaid, you can't then go to the marketplace and say, well, I'd like to purchase a plan through here and get some tax credits to help with that. So that's where we might be seeing some of these uninsured folks ending up over at Mountain Family. And then in the bottom right-hand corner, I showed the average annual Medicaid caseload, just to show that within the last year, we've seen a very significant decrease. Overall, for both these programs, since that peak around the beginning of 2018, we've seen about a 30% decrease in caseload. And that also goes into, for SNAP, issuances. So money that's coming into our community from the federal government, we're seeing about 30% less annually coming in, which represents a decrease from around $470,000 down to about $380,000. So that's money that's not getting to individuals. It's also not coming into our businesses, our grocery stores. Another interesting aspect in that top right-hand corner, there's been this word that's been going around called churn, and especially here in the resort regions, we look at the seasonality, and this is a term we've come up with to show people going on and off of the programs. This is difficult on households because you start to work, you can't afford food, now you can afford food, medical, you go over the income limit, so you drop off those programs. Now you're not insured, then you go and get laid off and you're back on. So I thought this chart really was a good depiction of that visually, of this up and down that we see. So this is an average over 3 years, where you can see spikes in October, November, going into December when people aren't working, but then during February, March, and April, we're down below the zero. That's where folks are back at work. But you can see how this would yo-yo for a family or an individual who's on an income-determined program. So when they start working, they have to report that, and then that pushes them off these programs. So they're constantly dealing with this on and off, which, especially with insurance, is, I have to imagine, pretty concerning and difficult, stressful to deal with. So those are kind of some of the issues we're facing with a decreasing caseload, significant, month-to-month or season-to-season churn that some of our residents are dealing with.
I think there's something about the churn, Sam, that speaks to me about workload, that even though the cases are going down, the applications still come in, right? And people are going on and off and on and off. So there's like this constant work that the team is doing around eligibility. That doesn't change. It's just the eligibility that changes.
Kelly has a question or
Yeah, I
comment?
do. I have a question with regards to the folks who are just dropping Medicaid and not transitioning to a program on the market or an insurance plan on the market. Will they have an opportunity at open enrollment, or is that precluded to them?
Yep. So in open enrollment, you can get in, and then it's really only the people who refuse the coverage that they're eligible for that aren't able to get that in outside of open enrollment periods. If you have what they call a life-changing event, even outside of open enrollment, you can then transition on to the marketplace. But those are, refusing service isn't one of those.
Yeah. Okay, thank you.
Okay.
Any other questions? Yeah, we wanted to make sure that you had this information because Ross's presentation is really about the growth in uninsured and the cost. And I
guess I have another
are you
question.
with Ross?
With regards to the
Okay.
churn, because you're
Sorry.
looking on a month-to-month basis, is there, are those the federal rules? Like there's no way to look at like a rolling average or something?
So here's where it gets complicated. For Medicaid, we can annualize income for people. That's within the rules. However, so that's saying we take their tax return and we divide it by their income by 12 and call that their monthly income. However, when someone works for a company that reports to the Department of Labor, those reports then paying off of our system versus the reported income. So we had someone who made $16,000 a year. That's about the maximum for a single person to qualify for Medicaid. But they made most of it in February, March, and April, and in July and August. When those paychecks come in through the system, they ping our system and send out a letter saying, there's a difference here. And if you don't call us, write us anything and let us know, hey, it was just this is when I was working, we can't stop the system from closing that case. So it closes them. They come in after they go to the hospital the next time and say what happened, and then we have to re-enter it. So that's where that churn comes in. It's not even necessarily people that are no longer eligible, but people who are getting caught up in that system that doesn't really meet what the needs are for a seasonal economy like ours. The other thing is when you get food assistance and Medicaid at the same time, the SNAP program doesn't do the annualized income. That's really more of a point in time. Do you qualify? Do you not qualify? Which then can shut down the Medicaid. So there's this issue with the gap between the 1,500 or so folks, or now we're down to about 14 that are enrolled in Medicaid, and we only have 200 some in food assistance, when in reality those income limits are very similar. So we would hope that everyone would be able to have both, but this issue with the churn and how you report your income causes such a problem in a lot of cases that we would guess that people are forgoing the food assistance just to hopefully steady their enrollment in their Medicaid.
Yeah, sure. I understand. Thank you.
Do they, if you have a month that you have more paychecks, they balance that out? I know disability does that.
Yeah, so what we
They
do,
make so much a month, but if you have a month with more paycheck, they don't automatically kick you out. They actually look at the calendar.
we can go, that's the thing, is we can always go back. And we typically, nowadays, we can go off of one paycheck, and we always ask, is this representative? Is this what your regular pay is going to be? And then the system calculates that on a monthly basis based on how many pay periods you have.
Right.
So they factor that in there, thankfully. But, when those Department of Labor hits come every quarter, if you've made more that quarter, it's going to tell the system to shut you down. It's the system that sends out a lot of mail notices. It's not really working for email yet. There's no text. So if you miss one of those 10 notices you got that said you need to take this action, your case
You don't
closes.
find out till you got to start back.
Right. And it's typically not a disaster. If your income's in the right level, we can go back. We can look retroactively for 3 months for Medicaid. But it's stressful for our customers, and it's a lot of extra work in our department when, if it would be nice if the cases could just remain open. But
Right.
I think this churn is really illustrates well what people, a lot of folks in this area have to deal with as far as income spikes and valleys.
Do you think, and I know Ross is here probably just arriving, so that's great. Another thing I think that's noteworthy, and so I apologize if you said this, Sam, I was organizing around something else, but look at the caseload number for SNAP and the caseload number for Medicaid. We have almost 1,400 on Medicaid and less than 200 on SNAP. It's the same eligibility threshold. And so when the state looks at that, or other groups, they say you have this eligible but not enrolled population, and that's what is there. Why do we have it? There are lots of theories, whether or not people are working under the table, or whether or not the SNAP is just it's harder to get, and the benefit is not that big. So it's a lot of work. You have to produce your income. You have to prove it on a regular basis. And but if you hear it statewide that we have this eligible but not enrolled, as do many mountain communities, that's the difference in the caseload between SNAP and Medicaid. Okay?
Thank you.
Ross? Come on up.
You want to put, just so he has a mic.
Yeah.
So
Is that mic on?
Ross, or-
Yeah.
Thank you,
Haven't
thank
seen
you.
you for a
You
while.
good?
You're good.
All right.
We're so fortunate to have Ross here today. You all have asked for Ross to present on what's happening with Mountain Family, and we have the opportunity in the Board of Social Services meeting to make that happen. So welcome, Ross. You have Lindsay here who's prepared to work your slides for you.
Thanks, Lindsay.
And thanks for coming.
Great, and thanks all for having me today. And thank you all as Pitkin County Commissioners for your partnership with Mountain Family Health Centers, with Human Services, Public Health. We couldn't do the work we do without each of you, so thank you. I'm going to share a little bit today about our organization, what we're seeing with the growth of the uninsured and decline of Medicaid. It sounded like Nan was just addressing some of that here in Pitkin County before. Some of the unintended and really unfortunate consequences that we're seeing with the growth of the uninsured and what we're trying to do about it for the benefit of the community. So our mission here on the next slide, and I always like to start with this, is to provide high quality, integrated primary medical, behavioral, and dental health in the communities that we serve, with special consideration for the underserved regardless of ability to pay. That's been our mission for the last 40 years and has remained relatively unchanged, and we aim to try to live that every day. Next slide, please, is a nice little graphic here of the care that we provide, whole person care, so medical, behavioral, and dental care for the whole human being. Next slide, please. Here's our pretty map of our locations. Basalt is the clinic that you all support in Pitkin County, and we are grateful for that support as well. We have 8 other sites in Glenwood Springs, Rifle, Parachute, Edwards, and Avon. Next slide, please. So we've seen significant growth of our organization in terms of the human beings that we serve and the patient encounters that we provide. This is a look at the last 12 months through the calendar year 2019, ongoing growth of encounters and human beings served. The problem for us from a financial perspective is the pie chart at the bottom there. So that's what we call our payer mix for our patients. The part of the pie on the left there at 40% is the uninsured at Mountain Family Health Centers. So 4 out of every 10 human beings, or better said, 8,400 of our 21,000 patients have no health insurance at Mountain Family. And we're going to talk a little bit about why that is. We've seen this deteriorate over the last couple of years, but that's not a good sign for our human beings, for our patients, for our community, and it's also a significant problem for us financially as well. Medicaid represents 32% of our patients, so that's on the right there in red. And then the remainder is 19% commercially insured individuals and a smaller percentage of CHIP Plus, which is the Child Health Plan, and Medicare. Next slide, please. This is looking back in 2019 is the massive growth of the uninsured encounters and patients across all of the Mountain Family sites, and significant decline of Medicaid encounters and patients across all of Mountain Family. It's about a 10 percentage point swing of uninsured up and Medicaid down. Next slide, please. This is from the Colorado Health Institute, released at the end of last year. This shows that despite the great gains made in our state, we've got about 5.5–6% uninsured in our state today. That's great movement in the right direction. Unfortunately, we're the dark shaded area here that has the highest uninsured rate in the entire state of Colorado. So in our counties, Pitkin, Eagle, and Garfield, which is Mountain Family Service area, we've got in excess of 14% uninsured, even despite the gains of the Affordable Care Act and the movement therein.
Hey, Ross, thanks for
Commissioner.
bringing this. Appreciate it. Just looking at that region, are we clustered together with these other counties? It just seems kind of, I'm shocked by this. And I'm wondering, why would Pitkin County have such higher grade of uninsured than, say, Gunnison or, Point South or Southeast?
Yeah.
And is this a statistical anomaly because we're bundled together in your region? I'm trying to understand this.
Is it you, or is it? That's what he's asking.
I gotta get in the Mardi Gras spirit. I don't have my beads on.
It doesn't fit my idea that we actually have a little bit more affluence in this community. Yeah, there you go. Before you answer, put on the.
Yes. So great question, Commissioner Poshman. We are grouped with those counties under what's called health statistics regions, and there's lots of other regional groupings as well. I'll talk a little bit about Garfield, Eagle, and Pitkin together. Unfortunately, the story is pretty similar in Garfield, Eagle, and Pitkin, and I really attribute it to the perfect storm of 3 factors that I'll get to in just a minute that we see bluntly across from Glenwood Springs to Aspen to Vail to Parachute.
Thank you.
Okay, next slide, please. This is one other data point from the Colorado Health Institute that shows uninsured rates by citizens and non-citizens. So we've made great efforts in our state to ensure that the majority of our citizens have access to health insurance. That's down to 5.8% at the state level, the rate of uninsured. But amongst our non-citizens in our communities, the uninsured is still at 27.1%. So this is going to underscore a little bit of why are we seeing the uninsured so high. One of the issues is fear in the immigrant community around public charge, around Medicaid, around other things that there's just real fear in our immigrant communities, especially when it comes to accessing health insurance. So next slide, please. So here are the three major reasons on the right-hand side here, back to Commissioner Poshman's question. One is the economy has improved in our state, and that's generally a good thing. What that means, though, for folks on Medicaid, and to qualify for Medicaid, you have to make $16,000 a year or less as a single individual, not 60. $16,000 a year or less as a single individual. There's no geographic modifier for an Aspen person or a Pueblo person or a Denver person. So we all know cost of living is much more significant in our rural mountain communities. That doesn't matter for Medicaid eligibility. So you make $17,000 a year as a single individual, you no longer qualify for Medicaid. So while the economy has improved, and wages are going up in many positions. Imagine you're a relatively low income earner now earning $17,000, $18,000, $19,000 a year. You don't qualify for Medicaid anymore, but your employer may not be providing you health insurance. And then to the last bullet there, and I'll come back to that middle bullet, we know we have very few affordable commercial health insurance options in our communities. On the exchange, in most of our communities for the last 3 years, there's been one option through Anthem. There's not significant competition to drive that rate down. So I may no longer be Medicaid eligible, but I may not have an affordable option on the exchange either. Then the most insidious of the drivers in my mind is fear in the immigrant population, like I was talking about. So kiddos who are born in the United States qualify for Medicaid. We oftentimes see mom and dad still being afraid to enroll their kids in Medicaid or CHIP. I know that the human services teams, the public health teams, the Mountain Family Outreach and Enrollment teams spend a lot of time trying to educate folks and say, give folks the clear, true facts so that they can enroll their eligible kiddos and families in Medicaid. All of that said, people are still afraid. They're worried about acquiescing future citizenship rights, and that's another driver of why we see the uninsured growing.
Thanks.
The consequences for human beings, uninsured adults are more likely to die early. That's a really unfortunate statistic from the Institute of Medicine. The uninsured are less likely to receive the preventative care they need. Uninsured kiddos are more likely to miss school, and the uninsured workforce is much less likely to be productive. For us as an organization at Mountain Family, the really unfortunate consequence is that we lost $750,000 through November of 2019. As the uninsured really started to grow, we posted a $750,000 loss through Thanksgiving of this year. And that is what underscored really our financial turnaround plan and some of the hard choices we've had to make over the last couple of months. Next slide, please. Our financial turnaround plan we put in place in October, November, and the goals were to protect care for our 21,000 patients and to protect our staff to the best of our ability. Next slide, please. So what are we doing about it? Really four main points of how we're trying to address it. One is we're trying to improve our payer mix. So I showed you that slide that said 40% of our patients are uninsured today and 32% of our patients are on Medicaid. We're trying to flip that. We're trying to be financially sustainable by having 40% or more of our patients have Medicaid and 30% or fewer of our patients be uninsured or not have access to affordable health insurance. That's important for our long-term financial stability. Second, and this is well within our control, is we want to be productive as a business. So we want to make sure our medical, dental, and behavioral health teams are productive in serving patients. And there's some areas where we do a really nice job of that, and there's some areas where we have work to do to improve. So I'll show you that data as well from the BOCC perspective. Third is we are aggressively controlling expenses, from external consultants to travel and meetings to a much more heartbreaking reduction of FTEs, which we have done over the last couple of months. And then lastly, we're continuing to work with all of our partners, be they federal, state, local, hospital, county, other partners, to try to increase contributions for the uninsured. I have to say, and I'll say this again in a later slide, the relationship with Pitkin County, Aspen Valley Hospital, and Eagle County, I think sets a gold standard for our state in terms of investment in integrated medical, dental, and behavioral health care and access for uninsured people in the community. Next slide, please. Another heartbreaking thing that we implemented back in October was, well, I'll tell you the good news first and then the bad news. One is no changes for our current patients, so we want our current 21,000 patients to continue to access us. We want to help individuals access health insurance whenever and wherever they can, be that Medicaid, Medicare, CHIP, or commercial health insurance. And we have an option for employers now where employers can buy into a program called Mountain Family Health Solutions, which is not health insurance, but it's access to primary medical, dental, and behavioral health care at Mountain Family. The bad news is on the next slide, which is we also implemented an uninsured callback list for new uninsured patients. So new uninsured patients that weren't already Mountain Family patients as of October 21st, we were putting on a 6-month callback list. Ultimately saying we would love to serve you, but we can't serve you for 6 months due to our financial distress. We created some pretty important exceptions to that rule, and those exceptions are listed here 1 through 7. One of which being all immediate family members of Mountain Family. So if your spouse was an existing patient of ours, you could still come to see Mountain Family because we don't want to break up families. Prenatal patients that are subsidized over in Eagle County, some of our school-based health center patients in Eagle County, patients with immigration physicals, and then patients that have emergent needs as assessed by our nurses. Those were our exception list. All of that said, we still today are putting patients on that 6-month callback list. That has been and continues to be a heartbreaking thing for us to do. It feels, it's hard for me to talk about it even still today because it's pretty antithetical to our mission, and it's a really unfortunate necessary evil of where we're at financially as an organization.
Ross, that was a 6-month callback starting on 10/21.
That's correct.
So what's going to happen in April?
So on April 21st, we'll start calling back those folks that went on 10/21. If you went on 2 months later, we'll call you back 6 months from that point. It is my hope that we'll start to get those folks in for care at that point. And I'll show this data, but I still think we're realistically as a business 3 months away from being in a better financial place where we can sustain that over the long run.
So Kelly has a question.
Yeah.
Joe, can you talk a little bit more about the product that you're offering to employers?
Sure. Yeah, so if we go back a slide to Mountain Family Health Solutions, we hosted a lot of uninsured summits over the last year to talk to individuals and employers and community members. Are you seeing this in your business, in your community? And I think the overwhelming response especially for small and medium-sized businesses was, I can't really afford to insure my own staff, is what we heard from a lot of different businesses. This is not health insurance, but it allows that employer for either their employees or for dependents of those employees to buy access to medical, dental, and behavioral health care for their staff or for their dependents. It's $135 per member per month, so that's what the employer pays, and then the employer can decide whether and how the staff share in that cost.
And then what does that allow for the patients in terms of services from Mountain Family?
They can access our medical, dental, and behavioral health care sites at wherever they'd like to. So if it's a Basalt-based employer in the Basalt Clinic, if it's a Rifle-based employer in the Rifle Clinic.
Sounds like a good deal.
Yeah.
Great idea.
Yeah.
And does that cover kind of your cost for a patient? Is that how
It
you
does,
set that
yeah.
up?
It really covers our cost
Yeah.
for providing integrated medical, dental, and behavioral health care. It's $135
Yeah.
per human being every month.
So that's really similar to I can't think what the system is where people subscribe to have a personal physician. They pay so much per month and
Concierge.
then and they get care anytime they need it.
Yeah.
Without having to pay every time they go in. So it's similar to that
Yeah,
system.
it is kind of similar to that concierge type of practice that folks have, that some other medical providers provide.
The cost is way up here for concierge.
Yeah. And I think maybe the differentiator for Mountain Family is the integrated whole person, physical, mental, and oral health care access.
We do have providers too that will accept Medicare, sorry, Greg, but ask for a financial rider, or they ask for, basically you pay $500 more and they will treat you as a Medicare patient. So the private sector has been doing this for a little while.
Yeah.
Sorry.
I was just, well, no, that's fine. I was just wondering regarding the patient mix. You put a 6-month wait on the uninsured, which is unfortunate. Are you reaching out more to? Is there a marketing or it's just by nature of making the space available, you have enough bandwidth or enough people coming to take those spaces that are actually Medicaid or part of the employer programs?
Yeah, great question. It's both and. So this doesn't apply to Basalt, but in Glenwood Springs, we just hired our first pediatrician. That's intentional to try to encourage Medicaid and CHIP access in our Glenwood Springs clinic. In Basalt, I think we have done some on the marketing and outreach, but I think we have more to do in partnership with our Pitkin County partners. We know there are Medicaid lives out there that we're pretty sure are either eligible but unenrolled or already enrolled in a program called Prime but maybe don't have a primary care home, and we have better work to do to make sure we're outreaching to those folks to say, hey, Mountain Family's here and we want to serve you.
We actually know that 3/4 of our Medicaid lives are unattributed.
So they don't have
we
a
have
PCP.
we're that's the grant that Sam and I are working on with members of Ross's group to try to find those people and get them attributed to Mountain Family. That will change their income, right? And get people to healthcare, quality healthcare. That's the biggest
And the
priority.
last part of that was, what's the waiting list for that group? Like, how long is your waiting list to get in, make an appointment? Are you 2 weeks out or?
Oh,
What do you
so Medicaid technically no waiting list at all. Time to next available appointment at most of our sites, and I don't know it at Basalt off the top of my head, but it's usually within 5 to 7 days.
Great, it's good to
And
know.
if you've got an acute need, we can typically see you that day.
Great, thanks.
Okay, great questions, thanks. And I want to honor your time too, so Lindsay, you can give me the foghorn if I'm going over.
You're doing
anything.
great.
Screen's gonna go black.
Yeah, that's right. And then Nan will steal
Then
my
I
beats.
get my beats back.
So here's what's working and what our challenges are. We have seen some payer mix improvements across Mountain Family. Basalt remains an outlier with still 40% plus uninsured. So, I think our partnership with Nan and Lindsay and Sam and with Karen to try to make sure all Medicaid folks know they can have Mountain Family as a healthcare home is a really important one. And frankly, tackling these issues at the state and the federal level are important as well. Trying to get additional state investment into the uninsured and federal investment into the uninsured and working to educate our immigrant families is an important part of helping people get health insurance. Second is our productivity that I mentioned, which is in our control, is improving across all of our sites. Our medical and behavioral health teams in the Basalt Clinic are either at or above the expectations. Our dental team has room for improvement, so that we're working on increasing access in the schedules to make sure that we get folks in for care when they need it. We implemented the expense reductions I talked about. In December and January, we saw a positive bottom line in those 2 months, and I'll show you this data in a second. And our days cash on hand rebounded from a very paltry 17 days cash on hand to 30 days cash on hand today. That's better. We're not out of the woods yet, but that's at least 1 month of operating cash versus 2 weeks of operating cash. And then I think it's always important to point out that our quality outcomes remain strong, and Basalt is a regional leader with some of the best quality outcomes in the state of Colorado, and I'll show you that data as well. So even in the midst of financial turnaround, we're seeing quality improve. Here's the payer mix across all Mountain Family sites. Today, that's at 36% Medicaid and 31% uninsured. We're trying to get that to 40% plus Medicaid and under 30% uninsured. Next slide, please. This is how things look in Basalt today, or I should say through calendar year 2019. So the real celebration here is the grand total on the right on 12-month patients served payer mix. 3,000 human beings got access to medical, dental, and behavioral health care in Basalt last year. Before we expanded and moved across the road in partnership with you, the best year we ever had in Basalt was about 2,000 human beings getting access to care. So in spite of everything, 1,000 new human beings in our community got access to medical, dental, and behavioral health care. And I think that's a huge celebration. That's going to continue and probably grow into the foreseeable future. The hard part about that has been that we put the uninsured callback list into place and said we need to stop growing access to the uninsured because it's such a big chunk of the pie today.
Could you go back a page and look at the that one? I'm just wondering if there's a seasonal attribute to the shape of that curve. Is it just from January last year to January this year? It looks like it's in a similar location. Is that not a
Yeah.
trend over? Does it do this every year? Do you get a flip? I'm just wondering.
Yeah, great question. There's a little bit of seasonality with the open enrollment period. What was really problematic for us is when the orange and blue lines crossed here. So historically, we've had Medicaid higher than uninsured. And when they crossed in June of 2019, that's when we really started getting into financial trouble. Right. What you can see with the uninsured dropping back down again is bluntly when we shocked the system with the uninsured callback list. That's how we flipped that back. But it's starting to converge again a little bit. So we have work to do to try to get as many Medicaid folks in as we possibly can with a declining Medicaid marketplace.
Sorry, Ross, do you see, are we tracking ER visits to see if the pressure is being absorbed by the hospitals or?
A great question, a little bit, and I don't feel like I've got really clear line of sight on that yet. Our partner Aspen Valley Hospital and Dave Ressler has shared that their primary care clinic over the last 6 months has taken on, I think, about 140 uninsured patients and 110 Medicaid patients, I think. So we're grateful for that. I think over the long run, we collectively agree that we want those patients served at Mountain Family Health Centers. And that's something that AVH has taken on in support of the needs of the uninsured and Medicaid. I don't know the answer to what's the real ER visits across really any of our hospital partners today.
When did they open their primary care visit, primary whatever?
I think it was June of 2019.
So that's been, short-lived. I mean, that's not even a year old.
Correct.
So.
Yeah.
I had another question just about the working relationship for behavioral health and your operation with the other behavioral health organizations, and thinking of whether it's Mind Springs or Hope Center or any of the others that might be referring or trading patients or however, sending people your way. Mm-hmm. Do you have anything you can share with us on that? I'm just concerned about cracks that people fall through.
Right.
With communications and space available, things like that.
So I think our partnership with Mind Springs on the whole is really strong. You all support access to behavioral health care through Mind Springs, and we're technically a subcontractor of Mind Springs to deliver integrated behavioral health to folks. And Mind Springs delivers more of the specialty behavioral health care to folks and crisis services to folks. I think those communications are generally strong. We are imperfect, and so we certainly always have work to do to improve those communications. I think we have a cordial relationship with the Hope Center. I think that is less of a referral base. Their clientele traditionally has not been the uninsured and Medicaid. So we do a lot more referral and integrated care with Mind Springs than we do with Hope Center directly today.
I'm just wondering if the hospital would recommend somebody go to your operation if they say they're uninsured or Medicaid patients that just how
I
does it-
think the hospital's doing a good job with the Medicaid. I think with the uninsured callback list we have right now, AVH and Dave's team are trying to authentically say, hey, we got to pump the brakes on uninsured referrals right now. All of us wanting to get back to the place where I don't have to have that uninsured callback list.
Thank you.
Nan, would you add any other color or context to?
No, I think that's good. I mean, we're so fortunate to have integrated care, not just with you, but with some of our private providers as well. Dr. Kotz provides integrated behavioral health care, and a couple of the other physicians. So it's becoming more of a norm.
Yeah, thank you. Okay. That's the productivity, which is more of an internal report, but I'm just sharing that in transparency. You can see our BOCC medical and behavioral health teams are meeting budget there on productivity, and our dental team is not in the BOCC clinic, so we're working on operational efficiencies to make sure that they meet or beat budget. This is what's happening financially. So the black bars represent the first 6 months of our fiscal year where we lost $750,000. The gray bars were if we didn't change anything about our behavior, what was going to happen. The blue bars were what we thought would happen when we changed our behavior, and then the black bars in December and January show what actually happened as well. So the good news is that the changes we're making are having a positive financial bottom line. To Nian's earlier question about when do we get to the point where we basically get to turn off that uninsured wait list that none of us want, I need to see in February, March, and April that we can perform at such a level financially so that we can hopefully turn that off as soon as possible.
Ramp it back. Turn it off, turn it off altogether, or ramp
Turn
it?
it off.
Or maybe
and
ramp
serve-
it back. Yeah,
Yeah.
I think there could be multiple ways that we go about it.
I think there are also, if I could, we didn't really plan this, but there are financial implications to Pitkin because we're a partner with Mountain Family Health. I don't know if you have a slide like that, but this one suggests to me the impact that we're feeling now is that the Healthy Community Fund agreed to pay, I think, if I have it right, 30% of the net costs, right? And the hospital pays the difference. We budgeted $35,000 and we've paid for 2 quarters of 19, $55,000 already. So we're looking at potentially another $55,000 or more from the Healthy Community Fund to complete 2019 to fix this, to help keep Mountain Family afloat. So what that means for the Healthy Community Fund is the reduction of the fund balance, right? And we're somewhere at about 90,000 now for fund balance. So there's a big fiscal impact. Not that it isn't important, but it's a real impact on how we support other agencies in the future. So, and Ross knows that. I'm not telling him anything, but I wanted to make sure you all had a sense of what those black bars mean for us.
Does that represent about a 3 times what is estimated?
What
that what I
we budgeted.
Yeah, the losses in 2019 in Basalt were 3 times as bad as we thought they'd be.
Do you want to add anything to that, Lindsay?
This is an updated slide versus the one that was in our packet, correct? This is different than what I had in my packet.
What are you looking at?
The same one, but it's different.
Ah,
I'm the paper, well, Steve and I are the paper people. But yes, I'm assuming this is updated because it looks like the information is more current. I'll show you later.
Okay, yeah, and I can double check that with you, Commissioner Clark.
Ross sent
I think
Ross
it's,
sent an
Either he
updated
wanted to see
one.
if we were paying
Thank
attention.
you.
yes,
You are
thank you.
doing
What is
great.
missing is the above the lines
Yeah.
on December and January.
Ah,
So
okay.
this paints a nicer picture than what we have.
Yeah, that's what I'm saying. You were just making sure we were paying attention.
Thank you for,
I was paying attention.
yeah, thank you for pointing that out. What I'm looking at with modest $8,000 profit in December and more significant $45,000 profit in January are the real numbers, the real financial reports. Okay, last but certainly not least are the quality outcomes. So I just want to come back to this, that health for human beings is still improving. at Mountain Family and in our public health ecosystem here in Pitkin County. And the green, we have this sophisticated technology called smiley face technology. So green means that we're performing better than our national peers. Yellow means we're running the middle of the pack. In red, which I do have at other Mountain Family sites, but not at Basalt, means we're performing worse than our peers nationally. If you look at things like depression screening and follow-up, that's really important. That means 82.8% of the Basalt patients through December 2019 were getting appropriate depression screening and follow-up. It's not 100% yet. We'll have a big celebration when it's 100%, but it's better than what we're seeing with our peers across the national marketplace. Hypertension control, diabetic control, getting folks in for cancer screenings, getting appropriate dental care, those things the Basalt Clinic is performing at or better than our national peers. So I think that's worthy of celebration and ongoing work even in the midst of what's been a tough financial time. And with that, I cede my beads back to Nan Sundin.
It's really
Wait,
to the board for questions.
Thank you for that.
I have a
great
question on your smiley faces.
Yeah,
Under the diabetic control,
yeah.
is the goal 32.8 on the national, but Basalt is 28?
Great question, Commissioner Clapper. So it's an inverse measure. So
Okay,
that's
so
the
you
percentage of people
want-
who are out of control. And so the lower that percentage is, the
Okay.
better.
Thank
That was another trick question.
Yeah, good.
That was a true question. Good
I'm
good
like,
attention
what
to
am I missing
detail.
here?
When you moved into the new building down there, you were still doing raising money for the capital campaign. Is that still going on? Did you raise the money you needed to finish getting the equipment and construction and all that done?
Yeah, thanks, Commissioner Child, for the question. Great one. The direct answer is no, we are not done with that capital campaign. We raised $2 million of the $3.2 million needed. We still have $1.2 million remaining. We got a low interest loan to offset that difference, so we completed the construction project, and the clinic's been operational for the last 12, 13 months now. But we still have $1.2 million remaining on that low interest debt that we're trying to pay down.
So that's a little bit of a drag then on your bottom line.
It is.
Paying interest on that and
Yep.
trying to pay off the capital with $45,000 profit and.
Yep. You're absolutely right about that. That is still part of our, I wouldn't say it's a huge driver of the financial distress, but it is a drag on that bottom line. So we'd obviously like to get that paid down to zero as quickly as possible.
Greg, you're so good at
I
raising
know,
money.
I was just
I'm
trying to,
looking
I
at
was
Greg,
looking
I
over
can
at
see
you. I was looking at the gold necklace. On it.
Yeah, I'm like, Greg is so good at
Yeah,
doing that.
it'd be
He's looking
nice
at me, I'm
to,
like,
what debt service is, what, 4,000 or 5,000 a month, I guess.
Yeah.
Yeah, so it'd be nice to have that taken care of.
Can you talk a little bit about the school-based health centers and what
Yeah.
you're doing
Yeah.
down valley with them?
Yeah. Great question. So the school-based health centers, we run today one school-based health center in Avon. We have been in partner conversations with the existing school-based health centers in the Roaring Fork Valley for many years. This coming summer, 2020, the Basalt, Carbondale school-based health centers are going to move from, they're currently sponsored by a Front Range group called Every Child Pediatrics. They're going to move from Every Child Pediatrics to Mountain Family Health Center support. We are of a couple thoughts around this. And I'm speaking on behalf of my board, myself, and the executive team. We're going slow on this given our current financial position and constraints. And we really think it's the right thing to do to ensure access to integrated behavioral, dental, and physical health care, especially for school-aged kids in our community. So when the Basalt and Carbondale school-based health centers transition to Mountain Family in the summer of 2020, we're going to go slow. They're probably going to be open 1 or 2 days a week, and we're going to go slow to make sure that we do it right. We also concurrently will be opening a Glenwood Springs school-based health center in partnership with the Roaring Fork School District and Colorado Department of Public Health and Environment.
We don't have a school-based health center in Pitkin other than what's in Basalt and RE1. So we're always eyeing what you're doing down there. in order to ensure that kids have access to healthcare.
I think I don't know, maybe in like 6 to 12 months time when my eyes get a little less bleary, I think it'd be worth having that conversation, because I think while we've had extraordinary growth, I still think this zip code, the Aspen community, especially for vulnerable lower income kiddos, remains underserved. And so a school-based health center might be a good solution here.
And just to remind you that we Human Services have sort of occupied with public health an office right next to Mountain Family Health. It used to be called Connect One, and we've renamed it Health One. And Sam's team is down there once or twice a week, and we're trying to work with Mountain Family Health around assuring that everyone who's eligible is getting enrolled, and that we're reaching out to people, whether it's Medicaid or food or whatever, and trying to make sure that they have access to the benefits that would help Mountain Family and help people access care. So, any other questions? You all wanted this presentation. Is that
That's good stuff. Thank you.
Yeah, it's really good to see you getting above the line on the monthly thing. When we first got the report back in the fall, what was happening, it was like, oh my gosh, I had these visions of all these things we'd worked so hard to accomplish kind of evaporating. And so it's good to see that we're getting turned around the right direction now.
Yeah.
Hopefully we can get the uninsured problem taken care of, partly by getting a lot of them on insurance or onto Medicaid. That would help the issue.
Yeah.
Is there anything, Ross, that the board can help you with as they approach the legislature or the state on committees that would assist us in ensuring the health of our community health centers?
Yeah, thanks for that question. Thanks for the support as well. I think, we've been talking with our legislators, Republicans and Democrats, joint budget committee members about potential investments into the primary care fund. That's a pot of money that goes basically for subsidies for the uninsured for medical, dental, and behavioral health care. So we have a Republican and a Democrat on the joint budget committee. So as much as you can support those efforts of, hey, we know it's a tight budget, but if there are general fund monies into the primary care fund to support access to medical, dental, and behavioral health care for low-income uninsured, that would be much appreciated. My association and organization are supportive of the state public option. I know not everybody in this room and in our communities is supportive of that, but I'm of the belief that anything we can do to chip away at making health insurance more affordable is worth it. I think the aspirational efforts of the Valley Health Alliance to try to create a community health plan are important movement in the right direction, and I support that because anything we can do to chip away at affordable health insurance is worth it for our communities. And then the last thing would be at the federal level, just an awareness of our federal funding is not secure over the long run. And technically in May of 2020, it comes up for reauthorization again. So yes, we support our local community health center. Congress, please reauthorize that funding would be appreciated.
Federal level. But did you know Julie McCluskey's going to be here this coming Saturday?
Yeah,
She just
I
got
did.
appointed to the joint budget.
And she,
She's
yeah,
going to be at Hops from 2 to 3.
with Senator Donovan as well.
But also
Or
in Basalt
Dylan,
in the
or maybe
morning that
Rep.
morning.
Roberts.
Oh, they're in the Basalt in the morning. Oh, I didn't get invited to that one. That's one I might want to go to.
So hopefully you'll keep us in the loop with health, at least Karen too, who's
Yeah.
in Washington as we speak, so that the board can get involved in supporting
Definitely.
the things that make sense.
Can I ask a question, which I'm sorry if you already stated, but is the concern with the public charge something that you're running into as well? Like, are folks who are uninsured but have this concern with public charge, are you running into hesitancy with them accessing services?
Great question. I think it's a real concern for all of our immigrant patients. And we're seeing less of a concern around them accessing Mountain Family, more of a concern with them getting their kids enrolled in Medicaid or CHIP, more of a concern with them getting enrolled in health insurance subsidies on the exchange if they qualify. My board chair told a story. She's a naturalized U.S. citizen born in Mexico, and she went online to our exchange to see what might it cost if she wanted to switch to the exchange, because it's pretty unaffordable through her employer. It asked her for a naturalization number. She's like, I've never used my naturalization number for anything. So the point there is a naturalized U.S. citizen still has some level of fear of, should I put this in the Trusted Colorado database? And the fear is real. Public charge isn't helping that fear at all.
I think it could help. For me, it helps because it's another point to argue contributions for the primary health fund. To say this is sort of a political environment where at least a one-time infusion right now might be helpful.
Yeah.
And that can be revisited in the future if this policy remains.
Yeah.
But okay, thanks.
Thank you. Great question.
Okay. Thank you, Ross.
Okay, thanks all.
coming
Thanks for your
up.
support, for your time.
Thanks so much for being here. We really
Do
appreciate
amazing work.
getting an update right from you and seeing all your slides. It's pictures worth 1,000 words. You can really see the
Thank you.
issues right there.
Thank you,
Thank you.
Ross.
Thanks, Russ.
Yeah, go ahead. So, you can have them if you want.
We have the lieutenant governor at our board meeting tonight, so I'll give her one.
All right, there you go. See how we pay it forward?
Yeah.
Did she leave already? Okay, so, we have a lot more to share. You all asked in particular for a Family First Services Prevention Act. I think it's Prevention Services Act. I think it's PSA. Sorry, guys. Isn't it PSA?
Yes, it is.
I think so. Well, come on, have a seat.
Take an easy spot.
All right, great. Okay. So do you want to talk about FFPSA first and then go into your year-end review, or how
Sure.
do you want to?
Yeah.
Great.
Good afternoon, everyone. I'm Matt McGaw with the Dalton Family Services, and I just wanted to give an update and answer any questions on the change in legislation for child welfare with the Family First Prevention Act. And so basically the state of Colorado right now is working diligently to implement the Family First this spring. And so there's a variety of things taking place. We've finalized a prevention plan that is going to be sent to the federal government for approval. And so we're hoping that that will be done within the next couple months here. Within that plan, there's a definition of candidates for who would qualify for Family First services, how the counties will work to have services available that are approved by the government to be funded through this act. There is a services group that's working closely with counties to try to ensure that these services are available, and identifying and approving services that the government is approved to fund through this act. So we will be getting more information on a fiscal analysis from the state on this in April, as they're still trying to understand how this may impact how we're currently delivering services through the funding streams that we do have. There's also efforts right now being made to improve the quality of the residential placement centers across the state. So there's several licensed facilities across the state, some that we utilize for our youth in conflict that need to be placed in residential settings. And so at this time, the state is working with these facilities to try to have them qualify and approved. And I don't know exactly the criteria that they have for this, but they're really looking at trying to improve the level of services at that level, because we've seen a lot of poor outcomes related to those services. And then there's a lot of training needs that are being considered for our staff locally. We're really going to have to work with the state on understanding how families will qualify for these services. And this includes coming up with prevention plans that are pretty specific from the state on how we would define who qualifies, and then how to try to connect them with the approved services that are available. Locally in Pickens County, we're trying to work with our schools and our local mental health providers to understand what services locally are available that are under this plan. So if I haven't been clear about that, they've approved about 12 specific services that are different modalities at different levels on where our families are at and what their needs are. And so we're trying to work with our local providers to make sure that these services are available here. And unfortunately right now we find that to be a challenge. Being in a rural county, there's not a lot of the evidence-based practices available. And so we've worked specifically with Mind Springs to understand what they have available and if it meets or matches the services that have been approved by the government at this point. So that's a challenge locally. We're continuing to work with providers to see if we can help them implement these services, or whether they need access to training or get more information from the state. We're really trying to help them understand what that looks like.
So,
Kelly first, and then
I have a general question.
Yeah.
So you're talking about the 12 modalities that you guys are looking at. So is this a system where it's like, this is what you can use and whatever you're doing now is now excluded? Or is it, this is what you can use and we'll give you federal money for it, and then if you're doing other things, you need to figure out how to fund it yourselves?
Yeah, so that's a really good question, and I'm still trying to understand that. Right now, there's 4 main components to the child welfare funding that they're trying to implement within Family First, and that includes our core services funding. So we'll still have core services available for families that we do contract with local providers to provide therapeutic services and parenting support. We'll still be able to provide those services even if it's not meeting or matching the modalities that have been approved. So we still have access for those basic services there. Under our 4E prevention funding is where we really need to look at how we can work with the same providers. Since we live in a rural small community, we have limited providers here. We really need to work with them so that we can use that funding stream to provide services for the families that are eligible. So most of the families we work with will be eligible for these services, so it is important that we work with our local providers to set these things up. So that's going to be a challenge for us right now. And so I'm working right now with a local group out of our collaborative management program to gather data from all of our providers to see who's providing what services. And then once we have all that compiled, we can go back and really start to see where the gaps are and try to work with providers or look at potential grants to fund some of these services.
There's a lot of conversation at the state level around the Family First Preservation and Safety Act, Prevention Services Act bill that the state put forward to try to implement the Family First program. And you all probably know that CCI and CCAT are opposed to the legislation. It has to do with the fact that they've embedded a new funding formula. So child welfare is generally funded 80-20, right? The county pays 20, the state pulls in either federal funds or state funds. And that's there are other little programs in there that are 90, but it's generally 80-20. And some of the bill legislation talks about going to 50-50 for out-of-home placements. If we had to pay 50% of our out-of-home placements with the first of all, it would be outside of our allocation. And we, it just continues to make it more complicated that we don't want out-of-home placement to be related to cost. We want it to be what is the best level of service at the right time for the right child. And you can see if you listen if you go to CCI or the legislation meetings, that this is a big pain point between the state and the counties. is this funding formula, and why are they putting it in here now, and what are they looking for? And it's gotten very complicated, somewhat related to their sense of trying to incentivize avoiding out-of-home placement, which we do every day with every case, with every client, and which we try to do and influence with the judges. Sometimes we're successful, sometimes we aren't.
But this is putting a dollar value on that.
This puts a dollar value on it, and we have no control. If the judge says, we don't like your recommendation, I want you to do an out-of-home placement.
And if it's 50-50, how are we, the county, gonna fund that?
So it's something to think about and to watch the bill. I was just at noon meeting with Michaela, and I talked about it again, that we're going to really have to keep watching this bill and stay with the statewide advocates, our big counties. I think we have CCAT and we have CCI, both opposed because of the fiscal.
So we should probably be starting to put together testimony. As we move along, have Michaela put together the bullet points for testimony, because sometimes we get the next day notice to go down and testify. So if we have it prepared ahead of time, we can get ready to roll. But my question was going to be, so these services, in order to be in compliance with the Family First Prevention Services Act, do you need to offer all these, or these are just the range of services you should be? It's not you're out of compliance if you're not doing A, B, C, and D.
It's about reimbursement.
Okay, so it's more about the funding again.
And there are more practices that are just sort of stuck in the pipe, right? We're hoping that it won't just be 12, there will be more.
Right.
But of the 12,
That you can get
there are
reimbursement
very few
for.
that we have. In fact, I don't know if we have any, do we?
So far, we found 3 of the 12 that have been approved. We have local services available. What gets complicated about that is that these services are on a continuum. So if we want to provide a full continuum of services, we really need to look at being able to match all 12 of those so that we have the right services at the right time for the families we work with. This is a big challenge for smaller counties.
And rural, the whole balance of state. The whole balance of state is having trouble because these services really exist in larger populations, right? They're time consuming and they cost money to provide.
So if we were to provide that service that we didn't have here, and we could get the client to Denver, wherever it was offered, how would that affect the reimbursement? Can you do it if you're providing the service outside of your own county? I mean,
there's so many questions.
Yeah.
A big piece of this is providing local community-based services and really trying to enhance that across the state. Each part of the state is unique, or different parts of the state are unique. And so really trying to have robust services across the state locally is what the state
And
is
again, that's because the point of the bill is kids are best at home.
That's
you know,
right.
and
Kids are
supporting
better
them
off at home.
All of this.
is the goal.
As
right?
long as
but
it's
we've
safe.
done things in the past with our 3 counties because of Eagle, Pitkin, and Garfield. If funding reimbursement was based on it has to be within your county provision of the service, if that was issued, that would be a point to bring into this act. If you're able to accomplish this within a contiguous 3-county or 2-county region, can funding reimbursement be allowed? I mean, I don't know if that's an issue.
Eagle County did a great job spearheading a tri-county application for something called multi-systemic therapy, which is one of the 12. We were not chosen, even though we thought we had an awesome application, because we don't have enough juvenile justice cases. So
let's get more kids in trouble.
So this is the
and
problem
we
with
can-
best practice, right? We don't have the N to actually practice with fidelity the model. They're really, all of those best practices are based on volume as well as outcomes, right? And so
And infrastructure.
And
A lot of the services really, you need a whole agency to be able to provide.
God, so those poor few children who are in need of help growing up in a beautiful environment outside of the urban environment, we can't get them the services they need.
well, we're gonna
We can't get
we're
paid
gonna
for it.
Can't get paid.
we're gonna make sure they keep getting services, right?
Yeah, the
And we
services
can use
are
core-
available.
Core
but-
funding for services.
Let us know.
Yeah, we sometimes have to just be creative with our case planning and treatment
We're
planning.
getting good at that.
Yeah.
Getting good at that, yeah. So that's Family First, and we have about a half an hour. So do you want to see any statistics? Would you like to hear about the housing stability? There's a lot in here. There's a little bit about senior services. These guys did some year-end numbers. What makes sense for you all in the next half an hour?
Well, I know that, and Chad walked out. I don't know if he's coming back. Are you
Patty's
covering?
here.
Patty,
Yeah.
you're gonna cover, because at Senior Services Council meeting, Chad had talked about rolling out this idea of some things with Eagle County.
A partnership with Eagle
And
County?
I think we should learn about that at least
Okay.
for the senior services aspect. We don't necessarily need to look at all the congregate meal numbers and
Right.
things like that.
Yeah, I'd like to hear what this joint project might be.
Okay.
So the Roaring Fork Age-Friendly Collaborative, as it's being
Patty,
called.
introduce yourself.
Oh,
for the
sorry.
viewing
I'm Patty Kravitz I'm the program analyst with Pickens County Senior Services. And actually tomorrow morning they've been having some planning meetings. It's with Eagle County and Carbondale, both of which are designated age-friendly communities. And we are looking to work more collaboratively with those other communities, to share ideas and practices. And as Chad has stated, the belief of senior services that such collaboration will strengthen existing partnerships, deepen interagency communication, and present opportunities for greater impact within the aging community in the valley. This is a new group. It's it's going to be, developed as we go. But we're looking forward to sharing more with our partners and perhaps creating some efficiencies. So we were talking about sometimes when you don't have the numbers in one community, if you can broaden, sometimes you can create some efficiencies for programming things as well.
So it's interesting with having the town of Carbondale also an age-friendly community now. We're kind of getting into Garfield County at that point. And so that kind of broadens the scope, because we've done a lot of things with Eagle County, but not quite as many things with Garfield County.
We are in communication a lot with Judy Martin from Garfield County. She covers a lot of territory virtually on her own. The group in Carbondale, as I understand it, is CAFKI, is what they're known as, a Carbondale Age-Friendly Community Initiative, and they're a grassroots group of community members who decided to take this on for their community. And so we do hope to, I think, involve Judy and Garfield County in the future. But I'm not sure that, I'm hoping, and I can't say that she's planning to attend tomorrow. I'm not sure about that yet, but yeah, they're not being excluded.
So Chad and I met with the public health director and the director of aging programs in Eagle, and we started scoping out this project and what it might look like. And so Chad and Carly are really trying to define what it might look like so that we can bring it back to you all, because it would be likely an intergovernmental agreement. And the nice thing for senior services, if you all support it, they have money in their budget, so it's a contract. So we wouldn't be adding staff, but we could add range and scope and ability to serve seniors in the Eagle County Elgin area.
Right.
So there's some excitement about that.
We've been looking at that for a while.
Well, we have. And sometimes
We're all
it's
getting older as we're looking at that.
Sometimes it's all about timing, right? And, we sort of lived through the IGAs that didn't work through Human Services. But, just a reminder how much better off we are now today that we're providing those services in-house. We didn't even know what we didn't know. So hopefully with seniors, the simplicity. The only reason we have to do an IGA is because the contract is with another government instead of a nonprofit. But the ability to serve our Mid-Valley seniors in a way that's more robust and to help Eagle provide more robust services is really attractive to both of us. Okay.
So I think it's good with change. Well, it's partly a change of heart or change of personnel in Eagle that has made this possible, because we were doing a lot of things with them that were cut out a couple of years ago.
Right.
So it's good that we're getting doing more with them now, and hopefully that will continue.
The new Eagle County manager is pretty proactive in that direction.
Right, so there's a new county manager, new deputies, new human services director, new public health director. We have, even though, you know, we went through a rough patch in ending our intergovernmental agreements, our partnership with Eagle is imperative to us. We've never stopped working with them, whether it was senior services or child welfare, or adult protection, or any of what we do. Veteran services, they're hugely helpful to us. So yeah, this would just be an opportunity to kind of reinitiate around a new topic that we haven't partnered with them on.
Okay.
Thanks for asking about that. I switched us right over to the initiative update because I thought that might be a little more interesting. If you have specific questions about the numbers, we just wanted to make sure you saw the caseload numbers since it's a fourth quarter report. But it might be helpful if Lindsay could do a quick housing stability update for you. And then any others. Did you have the, Lindsay?
Yeah.
Do you have the, yeah.
I do. Great. So as you probably know, the Housing Stability Initiative has been going on now for over a year and a half. And it consists of over 100 stakeholders now. I think Nan most recently said 112, which includes
We count you twice. Lindsay May and Lindsay Maish. That's confusing.
So 111,
Yeah.
112, around there. That includes reps from county, city, elected officials, business, nonprofit, law enforcement, and the faith community, and then people with lived experience, actually people who are experiencing homelessness. So in the last year and a half, a lot of work has been done, and at our most recent November, well, not our most recent, but in our fourth quarter meeting in November, an agreement amongst the group, the stakeholders group, to create a housing stability position paper was made. And we pulled the subcommittees together and started to work through creating this position paper. So what's included on this is a vision and mission of the group and guiding values. Our short and long-term goals, I'll try to kind of pull those up here so you can see
Quick question
this.
about the mission, just regarding
Yeah.
veteran and chronic homelessness. Veteran as in military veteran?
Yep.
Okay, and you're specifying that in the mission statement. So
Absolutely.
just how big an issue is it? What percentage of homeless are you looking at? Just wanted to ask about that when it's appropriate.
Yeah. Currently in Pitkin County, we don't have a great count on what we're actually looking at with veteran or chronic homelessness. We have a point in time count that occurred on January 28th, I want to say, that represented 22 people living in a shelter or staying in a shelter at this time, and we don't have the most up-to-date data on how that's broken out. We're going to get it. We'll eventually get it. Catholic Charities runs that through the continuum of care, and we'll be able to see how that's broken out. Point in time is really just a one-day count, and this year it was in the state of Colorado, it's only for shelter count, not for actual numbers of those who are veteran and chronic homeless. So we don't have a great system. And I think what's happening, and I'll mention this a little bit later, but the Built for Zero, have you guys heard of the Built for Zero efforts that are happening right now? Okay.
Especially after, reading the material.
Okay, it's in there.
I had heard of it, but I learned more about it reading your handout.
Good, yeah. So the Built for Zero efforts really do focus on getting quality by name lists, and what that means is getting an accurate, pulling accurate data on individuals who are veteran and chronically homeless in our county. What that requires is an immense amount of infrastructure buildup and working with community partners like Mind Springs Health, the Aspen Homeless Shelter, hospitals, law enforcement, Catholic Charities, Bright Future Foundation, to start creating a list that gives us accurate data on who is experiencing homelessness right now. Because the point in time count, it happens in January. It's not a great
We don't
time
know.
for us.
I'm just wondering why
Yeah.
veteran made it into the mission statement then. Just is that something that's done across the board?
It is more of a national practice to be passionate about ending veteran homelessness, and there's a sense that there's less resistance to the idea of ending veteran homelessness, and so that's a part of why we built it in. But most communities identify it as a separate goal. And also for us, I think our team talked about, and Sam can talk about this too, that there's a sense that it's achievable, that the numbers are so low in our community that we actually could end veteran homelessness. Sam?
Yeah, I think Nan just hit the nail on the head. That's a population that we work more closely with. It's really just taking that next step from chronic homelessness and adding another modifier to it that we really can grab a hold of. And while we don't have an exact count right now, we do know that the number kind of fluctuates between 4 to 7 individuals that we have regular contact with the organizations that we have housed up at the Human Services building. So there's a higher likelihood that we're going to be able to at least reach these individuals and offer services to them if they were interested in accessing them. There's also additional funding sources that can add on to what the other funding we're looking at. We're looking at applying for a Veterans Assistance Grant through the state, which would just increase the resources available for that particular population.
For transitional supportive
you.
housing,
That
so we could help
helps.
pay rent, that kind of thing.
So in picking out groups, I would love to see seniors added to the list as a separate category. And do you have any feel for, out of the homeless population here now, how many of them would be older people who maybe are, would qualify for, maybe they're not getting Medicare even, where they might be eligible for it, for instance. So do you have that kind of number for the aging population?
Anecdotally, I think they're similar. We drop some off the veterans list and add some from what were considered seniors. I think that the Aspen Homeless Shelter would have a better idea on the folks that they see regularly. Of those, how many are over the age of 60? But we do know there's some out there, certainly.
With the Build for Zero and creating a by name list, the program assesses each person for vulnerability. And the point is to put on the highest priority our most vulnerable people. So it could be related to age, it could be related to ability or disability, it could be related to a bunch of things. And that's sort of what this whole project is or Built for Zero, is focused on housing the most vulnerable, housing veterans and housing the most vulnerable first. Would you say?
Steve?
Okay. Yeah,
When I was at the I'm Home Now conference, touring these new communities that they're restoring, it was in Portland, they had an emphasis in each of the communities that we toured for veterans homeless. Tiny houses and small, adaptable modulars that were made adaptive for veterans with disabilities. I mean, it was huge. And just a sense of community with adding that population to families and others that were housed in these. These were small mobile home parks that were reestablished with new energy efficient solar powered modular homes. And it was really a great experience. And some of the funding did come through other resources such as grants, federal grants and stuff for veterans. So it was pretty amazing. And I have some of the data that I brought home with me, so I can share that with you guys.
Thank you.
That'd be great. Yeah, the intention of creating that quality by name list is to position us for those types of funding
Yeah.
opportunities.
It's a great resource for us to tap into. I actually just got an email from them with their updated newsletter, so see if there's more to come.
Yeah. Great. Any more questions about that?
I just wanted to say, I might have said this last time, but Garfield County with, in conjunction with their housing authority, Human Services and Housing, got a grant to house kids coming out of foster care. And they have opened that up to Eagle and Pitkin and other regional kids that are coming out of foster care. And we're already seeing, because those are our most vulnerable people, right? Even more vulnerable than anyone else for the most part. And I think our team is really excited about the opportunities, about helping some of our kids that are aging out of place.
Age 18, is that when they come out?
Depending on, when the judge releases them.
But it could be older, but it's not younger
Might
than
be
18.
older, might not
It
be.
can also be younger. We try to actually get them home or in a permanent situation before 18.
Yeah. So that's an exciting
Oh, scary for them.
part of this.
Let's see, I had one more question about the Housing Stability Work Group. Out of the 112 or 13, how many of them are homeless people in the county who are participating in the discussions?
I would say about 10%.
That's surprising. that
Yeah,
they come
it's
to the
really
meetings
nice.
and
It's
participate.
it's getting harder. So just a reminder that the majority of people who use the day center are working. And so we've toyed with having the meeting in the morning, at noon, and at night, and who comes and who doesn't come. And we just have found that we need to hold the meetings during the day, which is a barrier for people who are working, who are coming in as a volunteer. So Lindsay has ran a focus group in the last year, and we're talking about ways to make sure that we don't lose the voice of those who are experiencing homelessness in our plan.
And out of those who we call homeless, do some of them not consider themselves homeless? They're living someplace, and maybe that's their home and they're happy with it. Are we trying to help some people who don't really want help? Or
Well,
not?
for the most part, what we're using is a HUD definition of homelessness. And so do people identify or not? Maybe. Do some people want housing and not? Yes. Our intention is to ensure that there are options when people are ready to be housed. So that's the only answer I can give you on that one. There's a whole variety of experiences of those who are experiencing or have experienced homelessness.
Absolutely.
So we have this plan. Do you have thoughts or questions about it, or concerns about the direction of the group? We're really trying to hone in on the work plans and make it more specific. This was just the beginning of a document. We have a community engagement committee that's going to begin looking at how do we educate the community about the problem, about potential solutions, and I imagine that this group will continue to meet quarterly. We have a planning group that meets monthly, and we have committees that meet on a regular basis monthly. Lindsay's the chair of the data committee. Sam's on the housing committee. I'm on the community engagement committee. So we're pretty well invested in moving the project forward.
Yeah, Greg?
Just wondering if somebody wanted to get involved at this stage of somebody from the community wanted to be involved, could they come and join in, and is there a place for them to participate? And I'm just wondering,
Yeah.
how's the outreach going?
It's
And-
almost like every week I have one or two new people that I add to the list and they hear about it. But if people are interested, they can email me, nan.sundin@pitkincounty.com, or
And do you have a-
call the county main line. And we can add people to the stakeholder list. And then if anyone's interested in the committee work, they're always looking for new members.
Great. And is there a flyer or an online brochure or something, that?
That's an
Could I
interesting
just
question,
Take a
Greg.
picture of this and email it to people?
Not yet.
You could just use this and send
That's
it
a
out.
community engagement group. So,
You?
yeah.
Yeah, yeah.
So you guys know and understand capacity, right? Like we're leading this the best we can. We're gonna really need these committees to help us implement. And part of that implementation is we need a presence. We need a website. We need a link on our website. We don't know how to do that. We're social workers, right? We like to have learned helplessness
If you
about
were
the whole
social
thing.
media
We
workers.
don't know how to do it. And so we're going to be relying on, Pat has volunteered to serve on the committee. Mitzi Rapkin serves on the committee. And Sandy Ferlisi serves on the committee. So we're hoping that by the summer, we would have a web presence so that people could just go look something up, look at our outcomes, look at the Built for Zero success, have a sense of what we're trying to accomplish. And if you have other ideas, let us know.
Great, thank you.
Steve?
Yeah.
I think the efforts to find housing for young people coming out of foster care is critical, because we've seen the numbers of where they end up, and it's on the streets.
Or jail.
And jail and other issues that come up in their lives. And I think the other one is for people who have housing, suddenly lose their housing, have no options. They just may need a short-term turnaround housing.
Rapid rehousing.
Yeah, so that they don't get into the syndrome of being on the streets too. I think those are critical, and of course the veterans. This is perfect for you to put on your website.
Yeah.
As a flyer, as a handout, like Greg said. This is a great summary. My bigger question is, did you ever find a name?
No, and we're hoping the community engagement, we got recommendations, and then the community engagement committee said, let us take it. So we're gonna share with them the names we got and see. We need a better
Trying to
name.
come up with one like "Gimme Shelter," but the Beatles might come back at you on that one. Or, yeah.
We did get some good recommendations. But some of the things that you don't,
Gimme Shelter.
what you don't see on this sheet is that opportunities have blossomed as a result of these collaborations. And, the first would be the county's willingness to expand services for the winter shelter, which is having tremendous success at St. Mary's now that we are supporting a case manager on site. And they've come to an agreement on how that works.
Big.
We're yet to deal with the fact that the shoulder seasons are emergencies. So Lindsay and I are working on an emergency shelter plan, which other communities and counties have around emergency weather shelter. So that when there's a winter weather storm warning, we maybe find a way to go into emergency shelter so that we can, until we have a year-round shelter, or if we decide to do that, we have a way to protect people from the elements. And the other thing is that housing invited our staff to come over to talk about how they could use services to prevent homelessness. So we're helping establish a protocol for the Housing Authority, APSHA, to consider when do they make referrals, when do they call in the PACT program, how do we and support services help people be successful in housing so there aren't evictions, right? Because that's part of the problem.
What was that one shelter that was so amazing? It was over on the plains of Colorado somewhere.
Fort Lyons.
Is that where is that?
Transitional.
Yeah, it's transitional housing. Yeah, in Fort Lyons, Eastern Plains,
It's
near
in the Arkansas
Pueblo,
Valley.
I think. Yeah.
We have about, as far as I know, we have like 3 to 5 people over there now.
Have you been over there?
I haven't. It's an 18-month 18 month.
Maybe.
You can stay there for 18 months. It's a sober facility, and there's transitional supportive housing.
I might want to talk to you because I'm gonna have a few points that I need to, maybe this spring I'm gonna travel to in Colorado, and
Great.
so maybe that's kind of in my
That would be
loop.
good, because Phil Harrington from St. Mary's is the director of
Right,
Fort
right,
Lyons,
that's-
and it's in
That'd be-
Bent County.
It's in Bent.
Yeah,
So, yeah, is that
that's
Oh,
way
there's
the
a
heck
map in
over
here.
there.
Lana or somewhere along?
No, we have a map in here of the counties from.
It's over there somewhere. Yeah,
See if it's in my loop.
yeah.
Let's see.
Almost
Oh,
the
it's almost a
southeast
Baca.
corner.
No wonder.
Right, it's by Baca.
Yeah,
Baca
well,
Bend.
we got family there, so I might have to do.
I have a question. Is this a real, or maybe an observation? It seems to me like just a real shift in how the problem is being defined in a way, because, in some ways it's from something of a nameless, faceless to more of kind of a caseload
Individualized
management.
plan.
Yeah, and I don't know. Is that's what's supported by the Built to Zero model, is to make that shift?
It's more workable. Is when you start dealing with individuals, you start to be able to find solutions. If you're dealing with larger populations, there are just barriers all over the place. Can we build a facility with 20 units? No, not likely. Could we house one person? Yes. And we heard from Catholic Charities this morning that in the last year they've housed 20 people, right? That's a lot, one person at a time.
In our valley, or?
Right, so it's sort of the one starfish at a time model that is about how to address the issue instead of a broad bureaucratic or social initiative.
And it turns more into case conferencing and really meeting the client where they're at, instead of looking at the broad, there's this broad issue, and how do we attack that versus we have this list of 20 people. We can just
People can't fall
we
through
can
the
look-
cracks
right,
if there's no
exactly.
crack.
We
Yeah.
can look at their vulnerability, where they stand, and what makes the most sense in terms of the resources we have in this valley.
I would say almost all of our social work practices have moved to customization, individualization and customization. So what you see and what the Healthy Community Fund experiences is more agencies want case managers. They want, hands-on. They want warm handoffs. Ross talked about it. And, it's happening on every level in every part of our practice, that the way to help people be successful is to individualize the plan. Would say. You guys want to add anything to that, or?
I just throw out there that it's already starting to show some results. We had two homeless veterans in the pick-in here who were able to get the assessment done, which then allowed them to get, they're being considered right now for VASH vouchers. So those are Veterans Assistance
Yeah.
something housing. So through Veteran Services, getting some housing vouchers. So that's I don't know if that's happened. It
Sarah
certainly-
said one person has received the access to a VASH
And that's because of the collaboration with Garfield County
Right.
that we're able to do that.
Oh, that's big. One at a time.
Yep.
one person at a time, right? With the intention, then we can solve the problem. So it's really about attention and intention.
I think a lot of times about the 45% of the homes in Pickens County that are empty, basically. We don't have a housing shortage, we have an affordable housing shortage, and we have a shortage of housing for people who are like at the end of their rope, and
We have a vacant housing
We have
surplus.
a housing allocation.
right across the road from us, there are
problem.
3 houses sitting there unlived in right now, and it's like, it just
Yeah.
makes me mad and depressed, and wondering how can we change this?
The Housing Stability Group just works with a small part of that continuum. The housing problems are so complex in the county. And, part of what's taken us a year is sort of to really hone in on what is it we can do. And that's very different from making sure there's enough affordable housing for the workforce and seniors and continuing care communities and all of that. Those are other committee meetings we go to.
Yeah.
Yeah, we're seeing those pop up. I think John Fox Rubin has a group right now that's starting to meet where it's becoming more unique. So each group kind of has a unique population or focus that they're working with. And Built for Zero is really hoping to be able to kind of liaison between a lot of those efforts.
Wow.
So the only other last thing is just you saw in your memo that I signed on your behalf. You all gave me permission with John. With John's approval is the only way I sign. Several contracts, so just so you know. And in particular, transportation, the non-emergency Medicaid transportation is provided by the Northwest Council of Governments. They're going to be applying for a statewide RFP to get state funding to do this. So just a reminder that in Denver, there are 6 counties where the state pays for this. And the rest of the counties went up in arms about 1.5 years ago. And finally, the state has put an RFP out. So we're pretty sure, Northwest Council of Governments should be successful on our behalf to keep doing this, but it would be a savings of a whopping $7,336 for us.
And every little bit helps.
Every little bit helps.
That's because we're a 5-county regional consortium that is so so rural that transportation is not just driving them to 3 blocks down to where they need their services, it's driving them 3 counties away.
Right, and yeah, exactly. So anyway, any other questions before we close on time?
Good job.
Well done.
Good job.
Thank you.
Yeah, thank you, everybody.
Yeah.
Good job. Thanks for your flexibility, and
Patty, thanks.
let
for-
us know if you have any questions.
Yeah, and thank you all for coming in. So we need a motion to adjourn as the Board of Social
So moved.
I'll second.
All in favor, say
Aye.
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 Aye. Do we need a motion to take our break? So moved.
All in favor of taking a break, we will be back at 3:15.
Yep.
17-minute break. Wow.
Are you ready, Phyllis? Okay, grassroots. Okay, we're back on the air. This is Fat Tuesday today, and the reason I am wearing a crown is not because I am assuming the royalty position of the county, but I won the baby in the king cake, and so I got the crown.
George, I'm really glad you didn't win this baby in the king cake.
So,
We would've made
first
you wear
on
the
our
crown.
agenda after our break is prepping for the joint meeting with the city of Aspen, which will be held on March 10th.
March 14th I have.
Well, that's what it says, but March 14th is a Saturday.
Oh, and that would
We're
not be
meeting on
good.
Saturday, that was our new plan.
March 17th, is it?
So unless there's some different date that hasn't been announced yet.
We're meeting with the city on March 17th,
Thank you, Patty. That was the
4
day.
to 6.
St. Patrick's Day. Another day for
Oh, geez.
things.
Green beer or king cake? Let me see.
I'll bring an Irish soda bread. Great grandmother's recipe.
Does it have a baby buried in it? Oh, bummer.
They can, but it doesn't.
So I don't have any items listed in here as of yet.
What are we supposed to be talking to them about?
I wasn't paying attention, I'm sorry.
City of Aspen,
Joint
what are we-
meeting with the city of Aspen.
I don't know what we're supposed to be.
So we had talked at our planning meeting with John Peacock, we talked about we might be able to spend the whole time just going over what the priorities we each have arrived at from our retreats. Because we have both had, have a new list of priorities, and so.
And how we can work together on certain issues, like childcare is one of their top, and housing is on both of ours, but we're not talking about parking in front of the courthouse, right?
I do believe childcare is going to come up. They're preparing a memo with ideas that they've shared with Human Services and what's the best way to help either incentivize childcare workers, recruit childcare workers, are some of the solutions. And that would be the individual childcare providers that are they licensed through Kids First? I'm not really sure of the connection, but that's how they're connected.
And they may, if that's going to be a topic of discussion at that meeting, they may want to have Shirley there.
Mm-hmm. Oh, for sure. For sure, Shirley.
For sure, Shirley should be there, should show up.
I was, it occurred to me that we should talk about bears. The big ubiquity of bears coming out of the woods in the spring to eat people's trash and bird feeders, and that we could get a leg up on it. And I know there's a group forming to deal with it and make suggestions. A scientific-based group of wildlife specialists want to help, and so I was going to propose that they make a presentation to the board. But the time is so short. I wasn't sure if it'd be appropriate for a joint meeting or just to do it separately. But
I think
we'll probably
we should
hear
have
from
a
them.
separate meeting on bears and bring the CPW in and both the city animal, snowmass animal. It's got to be snowmass too. Snowmass has a bigger issue than we do.
And the city of Aspen has a bigger issue than we do.
Yeah.
But it's still something that affects all of us, and it'd
I
be
would
great if
like
we were
to
all coordinated.
See
Mark,
that
you wanted to.
discussion, a separate meeting when we can have CPW there and do the whole, because that would take an hour or so, and we only have a 2-hour meeting, I think.
That makes sense.
We can research.
Yeah,
See.
I think that would
Okay.
be
We
worthy.
could
Circle
ask
back
them
on
if
it.
they would be, just broach the subjects, ask if they'd be interested in doing a joint meeting just about bears with a presentation by CPW.
Well, we can have John ask Sarah that when they get together. But I thought we had talked about the energy code, talking to them about
Climate,
the
energy.
Did we
would
mention
like
that
to.
as part of our joint meeting?
Oh, but we haven't
Great idea.
finished it, so.
We won't have finished it by then either.
No.
So maybe that's premature.
Perhaps an update.
What about deconstruction issues, since most of the major deconstruction comes from within the city, and we have first reading on our deconstruction code. No, it's coming up, actually, it's on one of our agendas.
one of the things that they're looking at is housing impact fees, and we can share what we're doing. It's another way to let the public know as well.
We could
Yeah,
talk
I don't know
about,
that they're aware that we've revised ours.
I don't think they are.
And the energy code is coming up, I mean, the construction demolition program is coming up on the 11th for first reading, so we'll have something in front of us. Because I mentioned it today at the chamber meeting, and Tori was like applauding the fact that we were moving in that direction, but we need to have the city on board with it if it's gonna really make a difference.
Maybe
So,
the
but
same,
ask ComDef if they think it's ready for,
at the same time,
Another
during that
landfill.
meeting, we might want to put in something regarding the compost. I know the city, is talking about ramping up their composting, which would affect us because we're the ones processing it. Maybe there's an opportunity
so maybe
there.
it could just be, because the construction demolition thing is coming out of the landfill anyway, so maybe that would be see if Kathy Hall thinks there's any issues ripe for discussion. I would think.
we could talk about short-term rentals. The city is able to do licenses on short-term rentals. We are not able to, but we're working on legislation which is active, still alive at the state legislature, so.
Actually, we just got a proposal from, it turns out, the same organization that the city's contracting with for their licensing to just get an inventory of what's happening in rural Pitkin County and
As far as the
unincorporated.
second home, or the short-term rentals?
What's being published for rent as short-term
I
rentals.
think, in my conversations with Deb Bamesberger, she has said that the city has been generous in their sharing of information. So she may already have that.
Not for unincorporated Pitkin County. They do not have that. And Snowmass also uses the same organization. And they've been doing licensing for a while. So we've been running around that, trying to track that information down. So it's not very expensive to get the inventory because they're doing it everywhere.
Northwest Cog was gonna have a link on their website, and I don't know, to tell you the truth, if they do or not, with all of the permitting and whatever other jurisdictions are doing, because we're way behind the curve on it. Well, the city is. But the city just started talking about it. I don't know if it'll be ripe for discussion on the 17th, but that's another we can ask them if that's something they feel that they're ready to discuss.
And Snowmass has been doing it for a while because we started researching and getting references on the major companies that are
Silverthorne
offering
permits.
that services.
Eagle County might permit. They do permitting rather than licensing.
Summit County does.
Summit County, that's what it is.
And Summit County uses another organization, and it was interesting what you learned because Summit County ended up not owning the data, so they couldn't take the data with them, and we would like to own whatever data an organization.
They paid a consultant but didn't own the data?
Yeah.
Whoa.
So we're trying to, we're looking at what they're doing. Kara saw a great presentation. It was actually by Bentley Henderson, who used to be the assistant manager at Aspen, who's now assistant manager in Summit County. It's a small community
Yeah,
we live
yeah.
in. So we're working on all that. So short-term rentals may not be right, but if it's not, just know you have a team of people that are actually working on this, and
working on it.
Michaela is on this one.
Carbon offsets, that's at the top of my list.
What the city's doing for that?
Carbon mitigation program maybe might more generally be the conversation rather than just offsets, but while we're on the topic.
What would we specifically, just to see what they're doing?
Yeah, to find out what they're doing, share what we're talking about.
Doing?
Good traveler program at the airport's going, it's on the website now.
That
We're
would
an
be a great
official
opportunity
member.
to get it out to the public.
So that might be one way to open the
I
conversation.
flew with my carbon offset.
You did,
program.
good for you.
Yes.
Feel guilt-free. Have an extra cocktail.
Yeah, no, I didn't drink on the plane.
I'm gonna go find the tree that they planted in her name.
Yes.
Yeah, I am. I'm looking for it. Oh, but you need to talk about that forest program.
Cities for Forests,
Yeah,
I love that idea.
yeah.
That's one we could bring up.
Because
What was
they're a
that?
tree city.
Well, there's a program that's called Cities for Forests, where they actually match cities with forests, and the city actually kind of adopts a forest, and our carbon offsets go toward reforesting or.
It's like a sister city program.
Right.
The city is the king or queen of sister cities. It's a perfect program for them. They're a tree city and they're a big sister city, and this is a combination tree sister city. Say that 10 times really fast.
I'm having trouble typing it. Okay. You gave us a,
Air quality testing. It's on the top of my list also. I've got a bunch at the top of my list. How do they all
I
get
don't know
there?
if we have, well, you can see if they want to talk about that.
We'll see.
we have a lot here. We have
I
more
know.
than 2 hours worth. We'll
Yeah.
figure out what
Yeah.
flushes out and,
We kind of need to see what their list is too, and then meld the two lists together and.
Master plan discussion.
How about entrance to Aspen?
No, I don't think we're going to talk about that. Even if you are king for the day, I don't think we're going to talk.
That we could add 2 days to the talks with them if we did that.
And still be nowhere at the end of the discussion.
so I had priorities. What did each board identify? Childcare, housing, bears, deconstruction, composting, housing impact fees, short-term rentals.
I think I won't be here for that one.
Well, I think it'll be edited down by the time we have an
Unexcused
agenda.
absences.
I would hope so.
Carbon mitigation offsets and air quality testing. I just thought I'd go around it so
Thinking of
you
the
knew what was
childcare,
on the
housing,
list.
And maybe the deacons.
Kelly
Okay,
hasn't
so
said
it'll be interesting to see which of the three
Those are the
3 to
three
5
areas
of those
You already
make
had 'em
it.
there? Oh, thank you. So I don't,
Okay.
yeah, that makes me feel better.
And where are we hosting this meeting? Is it at City Hall? Because they never have snacks.
Does it tell me where it is?
It doesn't say, does it?
At City Hall.
Oh, it's at City Hall.
Okay. I'll put snacks at the top.
Because it's from 4 to 6, you know,
Healthy
appetizers.
Okay, let's move on to review of future agendas calendars.
Okay, I had a couple from John. Tomorrow, there is a duplicate item on the agenda. So when you look at it, item number 5, Steve, we'll give this to you.
We don't even have,
I was the one who.
That you
discovered
found it?
that, Yeah,
Okay.
5
What is
and
it?
8, I think, or 5
It,
and 9.
it's the Community Development Block Grant Business Loan through.
I brought
Northwest
that up
Cog.
2 weeks ago.
So it's a confirmatory reading, not a second reading, and it's in
Right.
both.
We're gonna do it on the second part of the.
Yeah.
Yeah,
Right.
Confirmatory reading should be separate from our regular agenda on their little spot.
Would the board be willing to schedule a special meeting for Airport Vision Committee recommendations? John's looking for a 3 to 4 hour block, probably an off Wednesday, when there's not a Wednesday meeting, to listen
In
to the
March or
recommendations.
I'll do that.
I would love to, but I have some doctor's appointments scheduled out in March. I'll let you know what the date is.
It would be a specific date in March after their meeting this week, so,
Yeah, I'll let you know. I don't have my calendar with me. I'll let you know when we go upstairs.
okay.
Is that intended to be an evening meeting or an?
Probably off-site with a large venue, so the public could attend, and probably late afternoon, evening, so the public could
So
attend.
off Wednesdays are action meetings from 5 to 7.
Correct. Thank you, George. I knew that and
I'll-
didn't think that.
Once a month or twice a month?
Twice a month, every other
Twice a month.
Wednesday.
It's every off Wednesday, so
That's not going to work.
we'll look for something else.
End of March
An
doesn't
off
work 'cause I'm
Thursday
gone
or
last
off
week of spring
some
break.
other day.
Yeah, Mondays aren't good for me, except for the 26th of March. I'll look at my schedule and
Okay.
let you know.
Maybe we should do a doodle poll,
We could do that.
and we could just put every.
Well,
off-
we'll figure out what we know doesn't work, we won't list, and what we think might work, we'll.
I'll
put
give
out
you
there.
my list.
Because Greg just said there's spring break at the end of the month, too.
That's when Greg's gone.
I'm gone that week.
So it would
He's
be
gonna
good
go
to have the
plant
full
trees
board on
in
this
the
one.
sister city.
If it's
No,
on a
we
beach, you bet I
absolutely
will.
need the full board to be there.
Palm
so-
trees.
Yeah.
I don't know where you're going yet.
What is this?
What just happened? on the computer.
That is a P&Z, that's a GMQS thing. It looks for,
I don't know what that. And adjusted it all by itself. You have a field, a force field around you? No, there it goes back again. I don't have this.
that's GMQS scoring for Oxley's property.
So
Oxenberg's
it's
or
something
whatever
that
it is.
Ellen is emitting some kind of ComDev rays, I think.
That's, computer's not even on, that's really weird. So, did you have anything else, Phyllis?
I did, there's I'm gonna shut that because I can't solve it. There's an executive session tomorrow at 10 a.m. for APSHA.
Just for APSHA.
Correct.
Yeah.
So I was checking to make sure we had representation
Yeah.
there. Okay. And that's all I know.
I have a couple.
Patty, I figured
oh.
you would.
Oh, wait, you got more?
I do. I have to go to the, oh no, it's open discussion, sorry. You're
On
good.
the 3rd of March, do you know what the, George might know this, I don't know, CDOT Safety Circuit Rider? What in the heck is that?
No idea.
It's a CDOT Safety Circuit Rider presentation, 45 minutes, and none of us have any idea what that is.
I'll give you a brochure on it in just a second.
How did it get on our agenda? I mean, I'm like,
Well, I'm gonna guess it was asked for. You have what it is, Steve?
Well, I can't even remember where I got this from. I think it was at CCI, but that's the flyer they have on it.
is it mandatory that they're coming to all of us to talk to us about this?
What is it?
So it's a CDOT program.
I don't think CDOT should be coming before us unless they're prepared to talk about the non-responsiveness we have to
To our yard signs.
Well, maybe that's an
Do you know
opportunity.
CDOT installed them over the Christmas holidays? Yeah, well, I guess he's on our schedule. I'm not quite pleased with it, but maybe that gives us the opportunity to talk about other things with him.
It's
when
on
he's
March 3rd, is what you're telling me,
there.
Patty?
Yeah,
I'm just
March
bringing it
3rd at
up.
1:45.
There it is.
So this has to do with development of local road safety plans. They'll look at the safety performance
Maybe
of different roads and intersections
And
in the
hazards
county,
next to
in
the
our
roads, like
county.
Maybe they'll
breakaway
put in a
signs.
new signal at the
Lots of
airport.
assistance.
I'm guessing they've asked for this.
Yeah.
They have requested it.
Well, they've asked for it then.
Can we ask them to be prepared to present on
Dalwhinnie?
illegal signage and
We can ask
trash
them whatever
pickup?
you want, Greg.
If they come before us,
advance.
he's
Yeah, sure.
open game.
Let's give them some warning. So
Yeah, I was gonna say, we could,
Probably not going to be the right person, but ask away.
Yeah, and then on the 12th is our transportation meeting in Glenwood. And they did change the times, so everybody knows, it's 11:45 to 5 p.m. And we don't know who's going.
I'm not.
I'm going.
Yeah, I'll be there.
I'll be there too, so there'll be 3 of us there, so it is noticed, so,
I'm actually scheduled to be at Club 20 right there.
yeah, no, and Kelly's going to be in Denver, right?
Kelly will be in
So there'll be
Denver.
3 of us there, I just wanted to know who was going, so we were sure we had somebody there.
okay.
Yeah.
And then, I wanted to ask, Steve, I think you know the Basalt Town Hall meeting, this is this Saturday with Carrie Donovan and Julie McCluskey.
So, let me look on my calendar, see if I put it on there.
Because they're having a town hall meeting here on Saturday from 2 to 3 at Hops.
So it's, there will be 3 of them. Representative Dylan Roberts will be there
Oh.
also. The 3 of them always go to Basalt
Right.
because it's in sort of all their territory. It's gonna be at the Basalt Library. The time is what I can't remember.
10:30 to 11:30.
Okay, it might be
10:30?
I'll either be at the one up here or the one down there. I'm going to the Glenwood Vaudeville that night. Have you been to it yet?
Are you going to Into the Woods?
I don't know
Or
what.
the
I think it's into
vaudeville?
the, into the woods.
Agenda item?
Yeah, it is. I just wanted to know if you wanted to go. It takes 2 minutes, George. Just relax. You're not going anywhere. You got a hot date tonight?
Okay, further,
Ellen's chomping
Look
at
at
the
him.
bit.
He's the chair.
further, What are we talking about here?
Future agendas.
Further future agendas.
So, since I will be chairing the March 3rd meeting, which is a joint meeting for open space and trails, I wanted to check in with the board because Gary asked me about how much deliberation regarding the Penny Springs management plan we would like to have with the board during that session. So I want to check in with you guys to.
It's just Penny Hot Springs?
I don't
or
know if
he's
that's
got
all
other
that's on the
items
agenda,
on the
but
agenda,
he
right.
wants to be sure he structures the agenda to give the amount of time that we think we would like for that.
I haven't seen it, so I don't know how much there is to discuss.
I mean, I'm assuming Gary will make a presentation to us, so
Whatever
he just
my
has
chief
to sort of
feels.
figure out how long his presentation is. There'll be probably some time for questions and answers, but since we haven't seen it, I don't.
Didn't we look at it at a work session?
Mm-mm. Not that I don't know of. The Penny Hot Springs?
I will relay that. Thanks.
And I just reviewed the packet, the Penny Hot Springs. It's pretty interesting information that they have. They have a whole section on the history and what's there. And
I've got some great stories, but it's not on future agendas. Can't talk about.
okay, anything else? Future agenda?
I don't have any.
Okay.
Okay, going on to board open discussion.
Open discussion.
And is that why Ellen is here for? And let's get Ellen up here first, and we'll
Okay,
do yours.
you can go first.
Great, thank you. So it sounds like March 3rd is going to be a busy day. On March 3rd, the Community Development Department staff is going to be meeting with the County Planning and Zoning Commission to kick off a discussion about the land use code and growth management as they both relate to climate action. And this is their regularly scheduled meeting. That item will be on the agenda from 6 till 8 p.m. And we thought it would be most helpful if we could have the BOCC chair and vice chair attend the meeting to kick off the discussion directly with the Planning and Zoning Commission. And we understand that Kelly, I believe Kelly is available to join. Steve will be
I'm out of town. I'm going to the National Farmers Union Convention as a delegate from Rocky Mountain Farmers Union. And I'll be in Savannah that day.
Wow, sounds amazing.
Yeah.
So we are looking for
March
a second, March 3rd from 6 till 8 p.m. here in this room. And so we're looking for a second Board of County Commissioner to join Kelly and the Planning and Zoning Commission that evening. So we're looking for volunteers. Don't know who's available.
Let me know if you can. I don't have my other calendar here, so.
It's election day. Super Tuesday. It's busy.
No, but I had something now on Wednesday morning, and I might be down Valley Tuesday night. So Greg,
Yeah.
if you can't, let me know, and I'll see if I can.
Put it on my calendar.
Actually, we'll be serving a light dinner at 5:45. So if you'd like to join for dinner, please come a little bit early. That's it. Thank you.
Wait, before you go,
Yes.
Steve, I thought I saw on our future agendas, I'm going back to future agendas, George, a discussion about GMQS is already scheduled on our agenda.
Let me think about that. Yes.
It's at a regular meeting.
March 25th, you have an item scheduled relating to growth management in the land use code. So yes, you're right. There
Are we
is-
going to have any discussion about what's coming up before that, or we're just going to?
I don't believe there's a plan to come before you before the 25th to prep. These are, I believe this is going to be coming to you from the county attorney's office. And it's, I believe it's looking at some minor changes to
Why don't I see it on
growth
the
management
25th?
that are relatively straightforward, simple,
What's your
just
question,
to get the conversation
My
started.
question was, are we going to have a discussion prior to seeing it on our
The-
regular
the
work
answer,
session?
I believe the answer is no,
No,
and
we're not.
Or not?
there, it's not, I don't believe the topics are significant enough so that a prior discussion is warranted. If you get to the meeting on the 25th and decide that it's premature, I assume that there's always the opportunity to,
I can go by and talk to Rye. For some reason, I don't see it on the 25th now. That's
it
weird.
is in this room.
It's on mine on the
No.
top of the.
So the Planning and Zoning Commission meeting is in this room on March 3rd,
Way up there.
5:45.
Looking down at land
The
use.
meeting that Patty is referring to is scheduled for March 25th.
It's
in this
under
room.
individual consideration items.
Yeah, GMQS amendment.
Yeah, it's way up
That's how
high. I
it's
was looking
listed.
under land use, that's why I couldn't find it.
Yeah.
And,
Thanks, Kelly.
yeah, and I think that's it.
I'll just
You know,
go
we
back.
will be, Patty, we will be scheduling some,
I'll just.
I believe the board at your retreat or subsequent to the retreat asked for some joint, at least one joint work session with the Planning and Zoning Commission to talk about what is and isn't working relative to growth management, as it may or may not relate to climate action. And we will be scheduling at least one joint work session with board and P&Z, but we have not scheduled anything yet.
But what's P and Z discussing on the 3rd? I thought they were discussing GMQS.
It's just
On the
really
3rd?
gonna be a kickoff discussion about relating to growth management and climate action, but we're not going to go into any great detail. It's really just to begin the conversation. We are at the very beginning stages, and so we wanted to get them on board.
Okay.
As to what's coming, moving forward.
Looking forward to it.
I think just relay message from our retreat and the goals that we.
The 2-hour meeting, just to talk about those?
Well, we're gonna present some information, some of the information
We're
that
gonna
you
meet with
saw at your retreat.
ComDev has a schedule set up in terms of trying to inform P&Z first, and then it will come for us. And so we don't want to sort of get ahead of ComDev's schedule in terms of how they want to sort of follow this process all the way through, based on a lot of things we talked
Oh,
about
I
at
didn't
the
know
retreat.
ComDev had a schedule.
Yeah, Cindy put together a schedule.
Well, maybe
because
that's something
because-
we need to hear too, so.
Yeah, but
Yeah.
more for her own work plan, trying to figure out
Yeah,
scheduling
well,
meetings.
'Cause
So.
it just seems kind of weird that we're gonna have this 2-hour meeting and you want 2 commissioners there to talk about it, and then we're gonna have a joint meeting with them. You would think we would have a joint meeting and talk about
I
it.
think they're not gonna stay the whole time, though. It's just kind of to
Oh.
Yeah,
present the concept and launch the thing and thank them in advance for working on it and those kind of.
thank you for clarifying.
General-
Yeah, I'm like really
general
confused. Sorry, we're having a
platitudes.
meeting, but we're not having a meeting, but then we're gonna have a meeting.
No,
so.
it really is just to have the board introduce the topic, where we think we're going to be moving forward, provide some direction, very broad, general overview kind of direction. Just to kick off the discussion, we're not going to be making any, certainly not making any decisions at that meeting. It's really just to start the conversation. And if you'd like, when we have tied down more of a schedule for work sessions, for reaching out to the public, which will be a huge component in this discussion, we will come back to you and let you know what we're thinking.
Okay.
So this is really the kickoff of growth that was identified from the
Right,
retreat.
I understand that, but never mind. I just was
Just a
left out of the
kickoff.
loop that there was already a plan and of scheduled
Yeah.
meetings.
As-
The beginning.
And as Kelly said,
know that.
really, we're just hoping that she and Greg can be there for the very beginning, just to introduce the topic, not necessarily stay for the duration of the meeting, which is going to consist of presenting some information, background data that you all have seen, just to get them started in thinking about where we're moving towards, what we're moving towards, and when, how. Does that help?
Sure.
Patty, we will keep the board informed.
We'll stay within
not to
we'll stay
worry.
within the
Yeah,
lines.
apparently there's so I just, I kind of on the wings on this one, and I'm like, just want to make sure I know what we're doing. Again.
Yeah, we're not trying to get ahead of you by any stretch. So,
Okay.
thank you. We'll plan on Kelly and Greg joining just to give an overview, to introduce the topic. Thank you, appreciate it.
Okay. Thanks, Ellen.
Thanks, Ellen.
And we should be getting the board the notes from the retreat, which we haven't gotten you all yet,
Yeah.
which might help on
I'd
some.
really like to get, who is the statistician who gave us, I think, blanking his name?
Gabe,
Gabe Preston?
Preston.
Yeah, I'd really like to see
and
his
get that to you.
slide
I-
deck. Yeah, I've been,
I just got that yesterday.
great.
He sent it to you as well, I have it, if you need it.
Yeah, no, I haven't. Okay, we'll get that to you.
Thanks.
So we'll get you the notes from the retreat and the Gabe Preston presentation. Because I was just working with housing, and there were some wonderful statistics in there, which also went to short-term rentals.
Great.
I have, my computer just went away. 2 items. Pete Loris agreed to be a regular on the Financial Advisory Board. So Charlotte would prepare a resolution for March 11th to appoint Pete and Scott Friedheim, both to the FAB.
Great.
Another citizen board, Healthy Rivers and Streams. You interviewed 4 people. It was Kate Hudson, Wendy Herber, Matt
Schmigelski.
and Chuck Ogilvy. Would you want to see their resumes or information? Do you want to have a discussion? How do you want to proceed with those 4?
Well, I thought we were going to discuss it today because we waited a week because Patty was out of town.
I'm back and I'm ready to make a
I'm
decision.
ready to have that discussion if the rest of the board is.
Sure, I remember them all, but I might want a refresher, a little bit of refresher, but we can do that right now. Let's do it.
I could start out with putting Wendy as the out of county. She's from Glenwood Springs. Her resume was misleading with her background, but I think her interview was terrific.
Yeah, I was really impressed with her. Her connection with the river is she is a fly fisherman, but she lives in the valley. She is the rector at the St. Peter's Church in Basalt, which is actually in Pitkin County. So she works in Pitkin County, lives in the valley, is interested in the river, has an amazing resume on things that she has done. She does have she is an attorney by
Non-practicing
training, although
attorney.
she's not practicing. So that could come in handy to help analyze or pinpoint legal issues that they maybe should look into greater depth on.
Well, I just think her interest in education and bringing the young people in the valley into being aware and helping to protect our rivers was important. I think and I also think she has her personality and her basic fundamental philosophies on life. I think would be good at bringing consensus with that board and working together.
I would support that.
I'd love to have a conversation about all the candidates before we vote. And I think I'd kind of like to start with renewing Kate, whether, that's the discussion I'd like to have before we decide.
Wendy's the only one
So
out
how
of
many
the
seats are
district.
open? We have 1 new seat open, or do we have 2 open?
We have 1 seat open in District 5 and 1 seat open out of district, and Wendy was the one who applied for the open seat out of district.
She was the only one who applied
Yeah,
for
the
that
other
seat?
3 are in District 5.
Oh, got it. Thank you. Thanks for the clarification. I just wanted to make sure, because the other, I liked them all.
That's correct. Yeah, that's correct.
I really liked all
Yeah,
the
that's why I
candidates.
started off with Wendy to get that off the table if we
Got
were
it.
going to
Thank
support
you.
that.
So does everybody support that for the out-of-county one?
Well, let's
Yeah, I
hold
mean-
off the final vote until we, I think, to discuss the others, as Greg suggested. So in terms of, I'll bring up the subject about Kate. I'm disappointed in some of the things she has done, personally, kind of using, she has a vast knowledge of legal things and Crystal River issues, but she's kind of she's got her own personal agenda she's kind of following, and that troubles me in terms of being on one of our county boards where they're going to probably be looking at that issue. I'm sure she will still be involved in it as an individual because she's passionate about it, but and I sense you maybe have that same kind of
Well, I do, but beyond that, I think we've got a really strong applicant in Chuck Ogilvy, longtime resident, longtime involvement on both sides of the valley, Eagle Valley, where he's a representative for the Interbasin Roundtable for many, many years, and then has fought diligently to prevent dams being built over on the Eagle side, Homestake too, and he has been involved for many years in terms of trying to designate the Upper Crystal wild and scenic, and continues to do that. So here's a fellow that has been integrally involved in preserving our watershed, and he's just a strong candidate beyond any other reason. I think he's the right person for the job.
Mm-hmm.
I agree with that, George. I just want to be clear, though. I'm looking at the membership here, and I don't see a requirement that we have a person who's from the district or from outside of any Pickens County districts. That it can be a person from Roaring Fork Watershed, not has to be a person from the Roaring Fork Watershed. So I don't think it's a requirement. We've just had to always have had one. We had Rick Neely for years, who was outside.
Yeah, when we first set up the board, we had that conversation in terms of how we were going to make up the board, and because we realized the Roaring Fork, the watershed goes through 3 different counties, and we thought it would be valuable to have someone who actually is not a Pickens County resident, but is within the watershed to be able to participate and bring a different, perhaps, a vantage point and input into the process. So we created that position. It doesn't mean it has to be filled by someone from the outside.
I mean, I'll take your word, because it's just the language here to me is confusing.
Yeah.
Yeah, and I think because we've been spending monies in Eagle County and in Garfield County, that kind of helps support that effort to not just restrict this expenditure to Pitkin County.
Also, one other consideration, we want to try to have one person from each commissioner district. We could potentially have 3 people from or even four people from the 5th commissioner district.
Right, it's not as strict as open space and trails that each would has to be in their district.
Yeah,
it's a little
this
more
is-
flexible.
We're striving for that. We're not
We don't have
anywhere
anybody
near
from Aspen anymore.
that right now.
Yeah, we do. My neighbor.
Yeah, we
Chris.
do.
Chris,
we've
yeah,
got
we
2
used to
people.
have,
We've got Lisa is in District 2, and Chris Lemons is in District 2.
but who was
Chris
but we used to
Wheatley's in
have
District
Andre, but he moved.
Andre's in District 5, yeah.
Yeah.
Chris Wheatley's in District 3, he's on there, right?
So Bill Yocums, and then, well, Chuck is in District
Yeah.
5, and then Kate also, so there's three potential people could be on the board, all from the Crystal River, which really is not very balanced, but,
We just haven't had applicants since Andre left Upper,
yeah.
but it's not as strict as open space and trails.
It's the issue I have about if we were to make a change now, Kate's been on there just for a single term, is that 2 years?
She's actually just filling a term in.
She's finishing a term, so she hasn't
She's
even done
filling
a
a
complete
term.
term.
There's,
Right.
I forget who had to leave, but she's filling the remainder
Somebody left because it wasn't,
of someone's term anyway.
She's completing somebody else's term.
Yes.
So the concern I have is that it seems pretty rare that we replace somebody without giving them I've never done that before in my term on the board, that we've decided to make a change after a short time. Kate's a provocative and engaged and an intense person. She's really sinks her teeth into the issue, and I have to say I appreciate the robust conversations and her energy focused on important issues. I think she's brought things up which are valuable, will help make it a better plan when it all happens. She doesn't always go the way we want her to, but I don't think I'm going to hold that against her. So I'm having trouble saying, well, she's too much for us. We're going to move her off and put somebody else in who's might be easier to get along with.
I'm not saying that at all.
Okay, I just want to make sure, because that's
No.
the feeling I'm getting, is that wow, she's provocative, so maybe she's too much for us.
No, I appreciate Kate's passion and her knowledge. It's just that when decisions are made after lots of discussion, in cross, back and forth and back and forth. She likes to hang on to her position and not like to let everything move forward. And there's a point in a time where you need to. I'm a good one to say that because it's not always easy to do. When you lose a battle, you have to say, okay, we need to move forward, not keep hanging on to that. And sometimes that just gets in the way of progress. And the board has to work together. And like George said, she's not like she's going to go anywhere, and we'll continue
Yeah,
to.
she'll still be there,
Well,
that's for
again,
sure.
I mean, if we're sort of comparing Kate and Chuck as, the decision for that seat, they're both fierce advocates for the rivers, which is incredible and an asset to us. I think Chuck has a demonstrated history of successes, that for me just elevates.
And working with adversity.
The opportunity to have him on the board is incredible. Not at all to any regard towards Kate and all of her efforts and advocacy.
And I appreciate Mike supplying and trying to bring some new perspective and new blood into the board. But we did, at the end of the day, get some really good candidates with lots of experience.
So one thought is, if you look at the resumes, the two people with the huge experience working on river issues, Kate's was in New York State, where she was really active in river
Chesapeake
issues
Bay
there.
too, I think.
So Kate and Chuck have the most experience on working on river issues and probably an understanding of the issues.
Kate's still the Western representative for, I'm blanking, the organization.
Riverkeeper.
Waterkeepers. So she's still
That's
active and
Chesapeake Bay.
engaged. She's the Western United States,
Yeah, but it originated out of Chesapeake Bay.
right? So,
And following your line of reasoning, Greg, if we kept Kate on, she could be the fifth. Chuck still represents Eagle Valley, and he could be the Valley representative,
Right,
even
but-
though he's living in
Right, too, but I think.
living in the 5th district, but he still has the connections to the Eagle Valley
Right.
water stuff.
But I think Wendy's brings a different perspective. We need to have all those perspectives, and I think Wendy's, just her basic fundamental personality and philosophy would be, I think, be a good asset to that board. She brings people together, and I think her passion and her understanding with education and the young is something we don't hear a lot, and I think that's what we're doing this for. Not doing it for us, we're doing it for them.
She also has a mediation experience. Doesn't
Yeah.
she train to arbitration, mediation?
She's
I felt good to read that on her resume.
Yeah, I was really impressed with just her calmness and her, just the way she presented herself. So I'm comfortable with Wendy and Chuck.
So mine.
So, and Greg, you would probably go with, well, I don't want to put words in your mouth.
I'm having a hard time letting Kate go this soon, as all things considered. So I think I'd probably stay with that. So I'll be a dissenting vote, but that's fine.
That's okay.
Who else would you choose?
I guess I'd be drawn to. I'd probably advocate for Chuck, quite honestly, just because he has that much more experience. As much as I liked Wendy, I'd probably put Chuck in there.
I agree with Greg. Wendy is an impressive person. She didn't stand out to me as having a particular passion about water issues and river issues that I don't think is already reflected on the board with other membership.
So you're saying Kate and Chuck?
Yeah,
I have a hard time.
I have a really hard time with that.
Well, Steve,
You've got someone on a board that is creates conflicts with one of our other boards, and so it's very difficult for two of our most important boards. If you got one person who's creating conflict between the two of them, and it's been ongoing for 2 years, and it hasn't improved, and it's not going to improve. So.
I've not been privy to
I think we have
that
to consider
information.
our other boards, our other group dynamics that are at play, and the ability for those boards to be able to pursue their missions.
I supported appointing Kate. Her interview was really good when she came in for the appointment, but it started off with just creating some adversity right pretty much from the get-go.
And I really don't want to have 3 people in District 5 on the Healthy Rivers and Stream Board. It becomes very parochial then in terms of looking at all of our issues that go far beyond the Crystal River
That's a fair
Valley.
comment.
That's a good
Yeah,
point.
that's a good point.
Yeah. I think Chuck is pretty much canvassing Eagle and Pitkin County in his activities. But I hear what you're saying.
So I'm the deciding vote, and I will vote for Wendy because I agree with Kate has been disruptive. I hate to turn somebody out who has
It's hard.
served on a board. That's tough. She's been passionate about it. But she has been divisive, and Wendy, I think, would be very unifying for the board and, be able to present a very reasonable, unifying kind of a presence there. She's an expert in conflict resolution, and a lot of times water issues can be very divisive, and I think I'll go with Wendy and Chuck for the 2, and I agree we shouldn't have 3 residents of the Crystal Valley, on the board. It's just too many. It's not enough diversity.
Again, I have to say that I really appreciate Kate's passion and her knowledge, and she really is passionate, and I know she'll continue to be involved, and I hope and I know that we'll continue to hear from her, and we can take her suggestions and her opinions and her knowledge into consideration. And when I first read Wendy's application, I was like, how is she even coming in and applying for this? So, the questions that were asked during her interview of this board to her were great questions, diverse questions, but I was really kind of blown away by her interview. It was like not to be expected, but yeah. So I think it'll be a great combination to get Chuck in there and Wendy in there, and we do need to send a great letter of thanks to Kate for serving.
So do we have 3 of you deciding to do that?
Yeah, I'm voting for Wendy.
Okay.
And I feel bad turning somebody out who served.
Yeah, it's hard. It's not easy.
That's tough, but
Sometimes we need to make those.
It's not a
yeah,
good
I
fit.
think we'll have a better
decision.
board with that combination.
Okay, and we'll have Charlotte.
Throw a little wrench in there. Lisa Tasker does live in Carbondale. Oh, sorry.
Oh, so she's out of
Afternoon,
district too?
everybody. Lisa Tasker does live in Carbondale now, so she's your second Roaring Fork watershed representative. So that's another.
We appointed her when she was living in.
Yes. Yeah.
She had been living
In town.
she had been originally up on Fox Run in
Fox Run, then she was a
Eagle
rep
County,
into.
then she moved into Aspen.
So if we wait a little longer, who knows where Lisa will be?
Does that allow anyone
It
else?
does. It says, should an appointed member's residency change during their term, but they remain a resident of the Roaring Fork Valley watershed, they may continue to serve as originally appointed.
We also have Andre and Lisa are both up for renewal in September, as well as Christopher. He must have filled in for someone.
He filled in.
So we have 3
Ken
seats
Newbecker?
that will be up
Yeah,
for renewal.
Ken.
Newbecker for
We have
Ken.
3 seats that will be up for renewal in September as well. And when do you start advertising for that? In June or?
The manager's office advertises citizen boards, so Charlotte probably
Charlotte's
will.
got a schedule.
Yeah.
So
We try to have them all at one
Yeah.
time so we can do our interviews all in one.
Funny, I remember
Spiel.
3 years ago, I put an ad up on, a social media ad up for help for the citizen
You were running for
boards.
office.
But even before then, was it? I can't remember after. But it was right about now. So I don't know if they're advertising now, but now would be the time.
Charlotte's got a
If
plan.
it was, then Charlotte will let us know.
Well, typically she checks with the folks that are up to see if they want to renew, and
Yeah, we give them their first dibs. And some of those we
Okay.
interview and some of those we don't.
All right, we don't have to take a vote, of course. It's a Tuesday.
It'll
The
come in a
Tuesday we just did a
resolution.
nod.
It's just like a direction for, make the
And
resolution.
then I think Charlotte will,
Comes back on
We're
reservation.
lucky to have such great candidates.
We are.
Yeah,
We've
we
got
are.
Absolutely.
It's a tough board.
It's a tough, it's a
Still
very
working on my
important-
son. Still working on my son.
And
it's a
that's
very
the last
important
item I
board, and
had.
we had
But he lives in
good-
Carbondale, so they'd all be different.
Good qualified candidates for it,
He can use
so.
my address, like to get into school.
Yeah.
Okay.
cool.
Thanks, Lisa.
Thank you,
Thanks, Lisa.
Lisa. So, any further board open discussion? I have one item. Kelly?
I just have an item. I want to just check in with you guys about how to check in on a couple pieces of legislation that sort of fall outside the purview of our representative groups. So there's three things that come to mind without being super prepared. One is public option. Another is the paid family leave bill, and then vaccination legislation that's moving through. And so I just want to check in with you guys about how you'd like to have a conversation about what our involvement should be.
I thought weren't we going to have a work session on vaccination with Karen?
Mm-hmm. But I don't know if that will come
Timely?
like over the summer or, so.
We could ask her to bump that up and do it sooner based on the legislation.
Mhm.
And then is, not Nutella, all I can think of is the butter, the hazelnut spread. Because you guys got, Michaela, is she, I know, that's what you told me to remember, but that's all I can remember. Is she gonna be coming and giving us any information, is, like we did with Kara, come in?
Mhm.
Yeah, so we can maybe ask her to bring those
Okay.
bills, because I had, I had something about the legislation too to
Yeah.
bring up.
And those just sort of fall outside the, like, CCAT is working on some of them, but they're not taking the lead, and then the governing board hasn't voted whether they're actually gonna take a position on some of those, so I just think it's, if we want
We
to
should
put in an individual effort from Picken County, we should talk about it here.
Yeah, we should.
So, okay, well, I'll get with her, and then we'll figure out when to put that on for we'll figure out when to bring it to next open
Well,
discussion.
and I had there are two mobile home bills that actually moved out of,
Don't worry, we strongly advocated for you at CCI.
yeah.
And I testified by remote. I mean, I just
thank
sent
you.
a letter on.
Because I was
on the
in
line.
California when they went, but I'm gonna run them by John Ely. Phyllis, you're gonna get a heads up, because we are now owners of a mobile home park. And I wanna see if there's any consequences in these bills to protect people who live in them. One of them is the payment of infrastructure improvements. And have Ely just look at those sections of the bills to see, and if maybe if it's gonna have a huge impact on our ability to, what we're doing at Phillips, how we might want to take that into consideration and address it if we can as part of the legislation. I just want to ask you too, if that's okay to do.
Yeah, certainly.
Have John just
And
look at them.
both of those bills passed the House Transportation and Environment Committee.
One's going on to,
On party line vote. The Democrats all voted for, the Republicans all voted against,
really?
which, to me, that's a red flag that both of them are gonna have trouble getting, even though it's a democratically controlled Senate, it's
Yeah.
a thinner margin there.
Well, you think that, I bet there's Republicans that live in those mobile home parks.
So,
Well, we need to get that force out there.
Let's see.
But I'll have John just look at him to see if there's any implications to the county being an owner of a mobile home park. I was thinking about that when I was on the airplane for some reason. So I'll run him by John.
okay, and I have one item. For several years, I've participated at the invitation of Chris Menges in this city of Aspen has a committee talking about climate change issues. And it's sort of an outgrowth of the Canary Initiative. And I've been to all of they've had like 3 previous meetings with sort of the same group of people. They're having the next one this Thursday at noon at the Picken County Library meeting room. And the topic is equity and climate justice. And there is a woman will be doing a half-hour presentation on that. And she comes from out of the state. I can't
What
remember.
time is that?
At 12 o'clock. Now, they're serving lunch at it. I'm thinking that Chris is I mean, it could be an opportunity to get more people to be able to go to it. And I don't want to invite everybody to go when Chris maybe doesn't want all the commissioners there, but I think if any of you are interested, it would be appropriate to ask Chris if you can go and even join the future meetings of this group, because it's kind of been looking at the Canary Initiative, their blue, what do they call it, the toolbox of different actions that they work on.
I wrote him a note and said I'd be interested, so let's see if he invites me.
Well, shouldn't we have Zach? Is Zach going? Zach should be
And
there.
Zach should be there.
So can we see that Zach gets an invite? He should be involved in that group since
Yeah, I think Zach, absolutely. If nobody else was, he should
Yeah.
absolutely be involved in it.
The title, just Steve, again, was Equity,
Okay,
Climate,
let me.
Climate
I can look
justice
it
and
up real quick.
equity.
Climate Justice and Equity.
If you have an
okay.
email, why don't you just send that to Phyllis so she has it?
'Cause there's a whole public health equity, so I wonder if
This is different.
So the
Equity's
woman
equity.
speaking is,
I'll send it to you.
Yeah, just send it to Charlotte and
yeah,
she can get it
I'll
to Zach.
forward this to you, but, let's see.
I'm sending it to Zach,
I can
Phyllis,
find out
and
if Zach
Charlotte.
knows about it.
Boom, I'm
Zach
sending
may
it.
already know,
I just sent it to Zach.
but they don't know. The
Send it
city
to
may
Zach.
not be aware we have Zach.
Never can tell.
Okay,
There's a topic,
Lee
siloed institutions.
Bomberger from Providence, Rhode Island.
What's her
has
first
a
name?
climate justice plan. And that's what she's gonna be speaking about, their climate justice plan
Gotcha.
at this meeting on Thursday.
Where's she from?
Well,
Rhode Island.
the study was on Providence, Rhode Island's climate justice plan. I don't know whether she's actually from there or not. So she'll be talking about climate justice issues.
It says RSVP by February 10th.
I'm like,
Okay, well,
I
we'll
guess
see
I
if we
can't
get
go.
Okay, I'll find out if Zach's going, though.
Yeah, Zach should go.
that. Anything else from your? on that?
That's all I have.
I had one. George, go ahead.
Yeah, quick one. Phyllis, I mentioned this, I think last week, I asked to have an update with Gary Tenenbaum and GR regarding the Castle Creek Trail. We heard Joe Wills came in and had some concerns about some changing in engineering that I was not aware of.
Okay.
I don't think any of us were aware of.
Yeah, they're supposed to bring it to us soon.
So just sort of an update.
I'll follow up.
Yeah, like we should probably hear it
I
next week.
I had a quick one. I don't know if you all saw that there was it's not an op-ed, it's not an editorial, but in the Aspen Times Weekly, there's maybe it's a segment called High Country, and the title is Roadside Censorship, and it's about the billboards, the pot shop billboards that CDOT put in on the side of the highway. And I think that you could assume that it's actually a piece of journalism, but it's not. It's an advocacy piece that the Aspen Times published, and it's upsetting because I think they missed the point entirely. They're talking about censorship when really it's about our history with billboards. And I just wanted to say I think it's actually a fairly poorly produced piece of work by the Aspen Times, and I'd like to know if anyone else thinks it merits a response.
Well, I already called her, since she interviewed both John Peacock and myself, and said some clarifications needed to be made. I'm supposed to call her back, but I need to have the article in front of me and highlight. Yeah, I've got a copy upstairs, I think, but I was concerned about, she didn't address the safety issues of the construction of those signs, and the fact that I think it's incorrect in the cleanup portion of that. According to John Peacock, who actually talked to this organization out of California, you pay a fee on a monthly basis. They're supposed to keep the highway clean. We have seen no effort to do so. It's not like a once-a-year thing that we know of. And they're paying they're getting paid, this group out of California is getting paid by Dalwhinnie for all those signs. Each individual sign has a price tag on it. And so where's that money going? And it should be going to cleaning up our highways. That would lessen the impact a little for me, but for CDOT to have not responded to our letter, especially about the nature of those signs, according to Brian Pettit, they're not installed as public safety breakaway signposts.
Standard.
So I don't want to wait till somebody in a little car crashes into that solid sign and we have injuries or worse. Plus, they're right in front of or behind the Adopt a Highway signs that are still there for voluntary cleanups.
Right.
So what do? And we all know we want to clean up our highways, but we want it to be done right, and we want it to not be done at the detriment to the scenic viewplanes from our highways.
I think this issue also isn't about pot shops. If the sign was a billboard for a Ford dealership, we would be just as up in arms, or maybe more so, but it's really about a billboard and an advertisement as well.
I also think there's questionable gray area of them putting in marijuana retail. You can read it on the sign when you drive by, and is that not advertising, which it violates the marijuana rules and regs of the state?
Well, I've planned to bring it up with our representatives
what I
on
was gonna
Saturday.
suggest this
And I
weekend.
think Dalwhinnie should know that they're not ingratiating themselves when they open here.
Right,
because of
and the
that.
fact that we're the only county that's complaining, maybe we're the only county that has 12 signs, in a 5-mile, stretch of the highway. I mean,
Well,
it's not like-
and, we had a long conversation about where to place the electronic sign for near
know, for
Cozy
Cozy
Point,
Point.
and it's like right in that whole view.
I know, and the city
you know?
hasn't said anything? Yeah, and they're the one going into Glenwood Springs is from Young Plumbing, the local plumbers. They have one sign there, just as you're entering. It's in Garfield County, but I believe, I don't know, it's kind of that gray area where the city limit is, but it's right there. But there's only one down Valley. There's
one at
there's-
Aspen Glen,
there's one at Aspen Glen.
which is also
And
some
marijuana shop.
kind of cannabis something.
Right. But for me, the issue isn't what the advertising is, that it's a billboard at all, and that we have a long history of not allowing signs like that on the road.
And the other ones are this big, and
Right.
so do we have 2 programs now to clean up the highway? Or is there just one, or
CDOT
where's
should've-
this money going to
CDOT
this?
should have taken the other ones out, because that
They-
program ended years ago, and they've just never cleaned it
Not
up.
according to that article,
Well, that's what I'd heard, that they don't even do it anymore.
yeah.
So, okay, anyway, thought I'd bring it up.
Well, we're not letting it go.
Okay.
So one thing, what
We're gonna put it in front
exactly,
of
I
your
would
house.
like to know, and it would be a
Road.
follow-up, Phyllis, what exactly is the King County sign ordinance with regard to billboards? Maybe our sign ordinance is such that our road and bridge department could just go and
And
remove them.
CDOT's right away.
You can't remove CDOT signs just arbitrarily, Steve.
Well, I want to find that out. What does
Steve,
our
if those
ordinance
signs are
say?
missing, you're in
Or
trouble.
we could use it as a basis for doing legal action or something. I don't know.
I think the question is, why hasn't CDOT responded to our letter to them? They responded to the local media, they did not respond to us. And the fact is, there's a public safety concern as to those being a solid fence post. According to Brian Pettit, it violates CDOT's signage.
Well, James Murray should have the answer to all those
That's right.
questions
You
next
tell this
week.
guy he's gonna be in for an earful when he
No,
gets here.
it's Knoll, James Knoll.
We're gonna give them a heads up.
You're
Like I
running
said,
the
he
meeting. It's James Knoll. I'm like, who, James who?
Yeah, he's already changing his schedule.
And his name.
You may have an agenda change coming up.
No, we want to see his smiling face
Okay,
here about
I
a program
think-
we've never heard
I
of.
think we are done for the day, and
Thanks,
thank you
Grassroots.
very much. This meeting is adjourned. Thank you,
All right.
Grassroots. And
All right, I
we'll
wanna
see
see where
everybody
your meeting goes
tomorrow at
tomorrow.
noon.
Well, we have
Some
to
of
do
you
this
will
again
see each
tomorrow?
other at 10
Oh,
o'clock.
really?